I'm just on a long drive up to North London to visit the All Dogs Matter charity. They are a fantastic organisation that rescue dogs that stray here in the capital. And today they've given me a call about an old dog that has a problem list as long as your arm. So I'm just driving up there straight away to see if there's anything that I can do to help.
It's a baby, aren't you?
Animal rescuer Sonia is waiting with a 14-year-old English Bull Terrier called Arnie.
So we rescued Arnie from the local pound. Arnie's coming in a really bad condition and he really needs Scott to have a good look at him and make him better again, make him the handsome boy that he was.
Hello, Sonia.
Hi, Scott. How are you?
Great to see you.
And you. This is Arnie.
Hello, boy.
Come on.
Oh, he's an English Bull Terrier. He is. He is. Oh, my goodness. You are so handsome, aren't you?
Boy.
You are so handsome. Sonia wouldn't have known this, but I had a rescue English Bull Terrier when I was going through university. His name was Zed. We had a massive bromance. I absolutely adored him. So to see another one here that I can help today, I think it's really special. He's got a nice shiny coat. He's a little bit thin, isn't he?
Bit underweight.
Bit underweight, yeah. And anything else?
He's got problems with his ears and his teeth as well.
His teeth, yeah. Are they bad? Can I have a look at this side, Arnie boy?
Good boy.
Yeah, they're horrible.
Then we've also got his paws.
Oh, ouchie, Archie, look at that.
Yeah.
Straight away, that dew claw's grown there.
Growing.
And then, oh.
He's got this huge lump.
Oh, my goodness me. That didn't grow overnight,
No.
so someone has literally just left that
I
to
mean,
grow.
how long would you say that's been there for?
Oh, probably a good year, I would say. I mean, it depends on what it is. And that's the real worry, is it could be something benign, it could be something horrendously malignant. So we won't know until we take it off.
It really is sad to see a dog come in at that age. For us, it's shocking, really. I mean, it's disgusting that people can abandon a dog at any age, but when they really need you and they're in such a bad way, I've got no words, really.
Who abandons a dog? I mean, he's given you all that love and attention and joy, and then at the tail end of his life, when he's got a few issues, dump him. Just heartless.
Too sad.
It's always very upsetting to see any rescue animal and understand why they have just been turfed out of a loving home. Arnie particularly is pulling at my heartstrings. I absolutely love them as a breed. I know what they're like. I know how loving and loyal they are. And his owners have gone, you know what, we've had our best years with him. We're going to turf him out. And it just angers me to the very core. I think I might take him with me, son.
Okay, I was hoping you'd say that.
Yeah.
Scott's going to take him back to Richmond. Him and his team are going to do some wonderful work on Arnie. Bye, darling. He has got a lot of things wrong with him at the moment, but if anyone can make him better, paws crossed, Scott can do that.
Let's go to Richmond, hey? Let's show off a big muscly boy. Yes, yeah.
Orlando, tell me the truth. Did you just give Coco some food under the table, yes or no? It's obvious you did. You are guilty as charged, young man.
Unlike Arnie, Coco the pug is a very much loved family pet.
It's definitely got a sibling vibe, their relationship. They don't just treat her like a dog, they treat her like an equal. If they're not with her, they miss her. When they come back from school, the first thing they want to do is see her. They kind of fight over who gets to have her. It's a lovin', general lovin'. Good girl.
But the bond is closest between Coco and Anna herself.
Yes. Our relationship is very intense. It is a love affair. I mean, we spend all our time together. It was important that I had to get a girl because I am the only woman in this house with 3 sons and my husband. I mean, she is like one of my children, as far as I'm concerned. I mean, she's my 4th child. You have to have a nap now, don't you, after all that eating? She likes the good life. She likes human food. She will bark at the TV if she doesn't like the show. She'll bark at my feet if she wants me to pick her up. So yeah, we kind of slightly have to sort of pander to her needs, let's say.
Anna is dreading her trip to the vet tomorrow. She will have to hand over her special girl for her spay operation.
It is going to be scary, kind of leaving her. I don't think I've ever actually left her before.
Coco might be unaware of the impending surgery, but she's lapping up all the extra attention.
Massaged, pampered, stroked, nestled on me. There's nowhere that you'd rather be, is there, young lady? She is little, she is a baby, and yeah, it's going to be a bit nerve-wracking. Good girl.
Come on, this way. Good boy, come on. Here we go. Come on.
Scott has arrived back at the Richmond clinic with
Come
elderly
on.
rescue dog Arnie.
Come on. Good boy. In you come. Hi, guys.
Hi, Scott.
Can I introduce you to a very special boy?
Arnie is
This
getting
is
a
Arnie.
warm welcome from nurse Nathan and receptionist Kirsty.
He is a rescue dog. Unfortunately, his owners, after having him for 12 years, 13 years, have decided that they're just going to dump him. He's an old boy with quite a few problems. Come on in. Go with Uncle Nathan. Here he is. There he is. Come on in. All right. I've just put a call through to a really good friend of mine to help with Arnie's care, and she is very much a fellow bull terrier lover. Ali, well, she's always wanted to be a veterinary nurse, and I thought this was the perfect opportunity for her to have a spot of work experience with her favourite breed. What do you reckon she's gonna... She's gonna go sick for you. She is. She is. Ali, this is Arnie. Don't cry, you're gonna make me cry.
No, darling. When I walked down and saw him, it was a shock. It was memories. It was, mixed emotions, but he's such a sweetheart.
Ali's first dog was an English bull terrier called Ruck, and it was through him that she first met Scott. Ruck has since passed away, but Scott and Ali have been firm friends ever since.
He's beautiful, isn't he?
He's very gorgeous. It just brings all the memories flooding back. So you start thinking about your dog and all the history with Scott and just how sad I was to lose mine. I just wanted to meet the little fella and see if he was all right.
Go and put some scrubs on, my dear.
Excited.
Scott has another motive for calling Ali in today.
We need to talk about what
He's
we're going
hoping
to do
she
with this
might
boy.
even consider adopting the old dog once he's nursed back to good health.
What he needs is a mountain of love. This boy has been shortchanged and he needs love urgently. Ali has such empathy and such care for animals, and she really wants to make Arnie feel loved, which is possibly the first time in his life he's really felt it.
Ta-da!
Ah, look. Looks
now
more
I'm ready.
nasty already. Very good. Right.
I'm ready to look after the fella.
Yes. So he has quite the litany of problems, and we need to just prioritise as his veterinary carers what we're going to do. All right. So to start with, have a look at this.
Oh.
Absolutely horrific.
Oh my God, it makes me so mad.
Also, you can see his toenails are very long. Very sad to know that he's got ingrown ones as well. Then last but not least is this is the piece that I'm most concerned about. Very vascular, very large, very nodular, all things which could suggest that it's something not very nice.
And if it is nasty, is it likely to be elsewhere?
It could well be. Yeah.
I volunteer with dog charities and it never stops making me sad how people can just abandon a dog. It's just a catalogue of neglect to me that people haven't taken their role as a dog owner and dog carer and, dog mum seriously.
All right, but let's sort this immediate issue out. I mean, look at that. It's gone right around.
Back into the pad. That must be agony.
Yeah. It just shows how amazing dogs are, that he is in constant discomfort and yet can still find love in his heart for us, even though humans
we do that to him.
Exactly. God, they're so big and thick. Yeah, classic bull terrier nails. There you go, mate. That's what healthy, normal-looking nails looks like. Much better. No more digging in. So already we've made his life better.
Absolutely.
The nail clipping was straightforward, but now it's time for the far more complicated removal of the nasty lump on Arnie's bottom.
The lump under his tail probably worries me the most because in older dogs, there are some fairly nasty types of cancer that can develop around the anus. Some of them, like carcinomas, for example, are incredibly malignant and if present, will be fatal very quickly. If you can pull his legs a little bit further back, I really want to see that sort of come right up to me. That's it. Great.
Arnie's surgery is about to begin, and already Scott is worried about the elderly dog.
He is breathing a little bit roughly, so we are concerned about the anaesthetic, and we need to just make sure we keep a very close eye on him. All right, I'm cutting now. You ready to go? So what I'm going to have to do is cut through the skin. Once I start cutting into it, I can see it is just bleeding everywhere. But thankfully for Ali, she was tough enough and she didn't faint. Dog okay, Nath?
Yeah, it's fine.
Here we go. This is going to come off now, likely. All right. Come on. There we go. There we have it. Nasty looking thing. And unfortunately, it's so big and so thickened that I wouldn't be able to say that we've got good margins so that we have 100% cure. But we need to send this up to the lab and the pathologist will tell us what kind of cells make this up and are they bad ones or is it just an abnormal growth of an old boy. Let's hope
And
it's
if
the
it's
latter.
a bad one, what you're saying is you might not have got it all.
That's right, and I can't take any more away because I'll then affect the ability for his bum to work. He'll be incontinent, which is yet another reason why he won't get a home, so.
I meet lots of rescue dogs. I've met rescue bull terriers, not many, but I haven't been involved in surgery and he's so neglected, he's such a mess. Who's going to take him?
Come on. He's been a right soldier, hasn't he?
He has. Love him.
The next few days here at the practice is going to be an agonising wait because we need to wait for the pathologist's report on Arnie's lump. There you go. Hopefully, if that comes back okay and it's not a nasty type of cancer, then we still have to put the poor old boy through yet another anaesthetic to sort out his horrendous teeth. And then we've got to find him a new home. So there's lots of question marks still to come in Arnie's future.
I know, it's just me. It's just me. I know.
I'd like to think that Ali's thinking about taking Arnie.
Darling, I know.
He is definitely twanging her heartstrings. And I think that he will be a very lucky boy if he gets to go home with Ali.
It's okay.
I think this is like his favourite thing, isn't it?
I know, just wants
getting
cuddles.
A day after surgery to remove a massive lump from his bottom, elderly rescue dog Arnie is recovering well.
It's a hard life, isn't it?
And nurse Reagan and receptionist Kirsty are making sure he's getting lots of love.
Having Arnie here has been amazing. We've all fallen in love with him. Any kind of bull breed, I absolutely love them. And he's just been quite a good addition to the practice.
The old dog's next round of surgery on his badly neglected teeth will be in a few days. Scott and his team are hopeful he will then be well enough to go to a new home.
Oh, good boy.
So Phoebe should be getting here pretty soon.
Yeah, how exciting for her. Cool.
A new
I'm
vet
really
is
excited to
arriving
meet
at the practice today, and Scott and nurse Reagan are waiting
Really
to welcome
excited to
her.
meet her. What's she like?
She's very nice.
Yeah?
Yeah, very wide-eyed, very keen.
Cool.
And sure to be very, very nervous. This is the first time I've ever employed a newly qualified vet. It's quite a big undertaking because they do need quite a lot of support. But at the same time, I met Phoebe last year. She came and saw practice here, and we really liked her. She got on well with my team, and that's really important to me, so I thought I'd give her a go. Ah, and here she is.
Hi.
Hey,
I'm Phoebe.
I'm Reagan. Nice to meet you.
Nice
How you
to
doing?
meet you.
Welcome.
Hello again.
How are you feeling?
Nervous.
Yeah.
But excited.
Good.
Yeah. It's nice to have Scott as a friendly face on your first day. I'm really glad that I did placements here, so at least I vaguely know my way around most of the staff and the buildings.
Well, we've got lots of exciting things lined up for you today.
But you're going to start me off easy, right? Vaccines, health checks.
We'll see. We'll see. You've done lots of learning. Now I
Yeah.
think you need to get your hands dirty.
Okay. Wish me luck.
Good luck.
Should we go walkies? Come on, good girl. Where are we going?
And it's not long
we
before
gonna go
Phoebe's
here?
first patient arrives for her appointment.
Hi, Kirsty.
Hi, how are you?
I'm all right. How are you?
Yeah, good. You got Coke?
I've got Coke.
Phoebe might have been hoping for light duties first off, but she'll be starting with a surgery.
My pug, Coco's being spayed. I know it's kind of a normal operation, but it's a bit stressful because it's my baby.
Yay. Yay. Oh, yes.
Hi, Anna. I'm Phoebe.
Hi, Phoebe.
Nice to meet you.
Nice to meet you too.
And this is Coco.
Yes, this is Coco.
Hello. Right, let's come through.
It might be only her first day on the job, but graduate vet Phoebe is quick to recognise canine blue blood.
Oh, she really is a little princess, isn't she?
Yes, you are. Well, apparently in China, they were only owned by the Chinese aristocracy and kings and queens, and they actually had their own servants.
So does Coco have servants?
I'm an unofficial servant. I do everything for you, don't I? Totally in your power, young lady.
Yes, I am. Yes. So what's Coco in for today?
Her spaying.
Her spay.
Spaying.
Are you nervous?
A bit, yeah. Just because it's an operation.
You have no problems with her health-wise?
No, she's fine. She's really healthy, loves walking, eats well. Actually, she did have a hernia.
A hernia?
She was little, quite a big one.
Okay.
We were told to monitor it, and it's kind of now disappeared. But I know that if you find it, you might be able to take it out in the spay.
Yeah, it's not there at the moment.
No, it's just completely disappeared.
But that is the thing with hernias, is that they can pop in and out. So definitely we can look at it while she's under, and if there is a hole, then we can close that up.
Okay.
She's going to be absolutely fine.
You'll be fine, young lady, won't you? Yeah? Good girl.
Anna dotes on Coco, and she was very worried about the surgery. So I hope we set some of her fears at rest.
Right, I'm going to leave you now, Coco.
Bye. We'll take good care of her.
Bye. Good girl. Go on.
You'll be back with your servants soon.
Yes, your servant and your mother and everything. Bye, lovely.
Bye.
It's going to be a stressful day. Until I get the call that she's okay, I'm going to be a bit on tenterhooks, I think.
Are they talking to each other? Yeah. They do talk to each other, don't they?
Scott's next two patients are in Hampton Hill. They're a pair of elderly tortoises that recently came to live with Simone and her young family.
They seem very hungry today, don't they?
A friend posted on Facebook that his parents were retired and that they were looking to rehome their tortoises, and would anybody be interested in having them? And I jumped at it. Yes, yes, please, please. We have a boy and a girl, Molly and Atwin. We haven't had them that long, and I absolutely adore them. And they've become a very, very big part of our life, like all of our lives, the kids as well.
Is he gonna like Apple?
The pair will be Scott's oldest ever patients. They're estimated to be over 100 years old.
We assume that they would have been brought over from Africa in between the world wars, the First World War and the Second World War, and they would have survived the Second World War in England somewhere, which is incredible. I was so excited to get them, and then suddenly was all scared about, but I have to look after them really carefully. People before me looked after them so well, then to brought them to this stage, I feel I can't sort of drop the baton now.
But recently, Simone has noticed male tortoise Atwin has a problem. So she's called Scott to check him out.
Hi, Simone. How are you?
Scott.
I can't wait to see my reptile patients.
Yeah, come in and meet them.
There's
one of the patients.
There he is.
He's walking quite quickly for an old timer.
They move quicker than you would expect. So,
Hello.
so this is Atwin. So this is the boy.
It's absolutely incredible, isn't it, to think that you're holding a 100-year-old animal.
I know. It's quite a responsibility.
Isn't it? It's great being a vet when you can go out and about and meet other animals, but particularly ones so old. A full 100 years, it does make them incredibly precious creatures. So I can see that discharge. How long has that been there for?
Probably about 2 or 3 weeks.
Okay. And do you think it's affecting him at all? I mean, is he coughing or sneezing or...?
Not that I've noticed.
No.
And he's eating lots, and
Eating
as you've
well.
seen, he's active.
Yeah. Okay. Having a general look at Atwin, he seems like a very healthy tortoise. But runny nose in a tortoise, generally it's not just a simple cold like in people. In a tortoise, if left alone, it can become something more complicated, something like pneumonia. I think what's happened in this case, he's a new animal to you.
Yeah.
And I think during the process of movement from the old to the new.
Yeah.
He's an old boy and they don't cope with change very well.
Yeah.
So I think he's probably got a little bit stressed and as a result has developed this condition.
Yeah. Oh, good boy.
There you go. After putting a couple of antibiotic drops into Adwin's nostrils, he looks wholeheartedly unimpressed, but as a 100-year-old, he's allowed to be a bit grumpy, but he seems very happy and I'm sure he's going to make a full recovery. Good boy.
Give him a rest.
Yeah. All right, then.
Give
Go
him then,
pop in his
buddy.
bed.
Let me take you to bed. I'm very relieved that we got Scott around. Part of me initially was, oh, it's just a bit of a runny nose. I don't want to waste his time. But I'm very glad that we did call him in.
So you've got another tortoise somewhere around here, haven't you?
She's just over there in the corner. Shall I go and get her for you?
Yeah.
Atwin's partner is a female called Molly.
So she's a lot heavier.
And is she equal in age as well?
Yeah, they've been together for about 80 years that we know of.
And do the old couple get on very well?
Yes, he can bother her at times. And
Bother? What do you mean?
How do I put it tactfully?
I don't know. What are you going to say?
So Atwin does harass Molly quite a lot, and their mating ritual is essentially to headbutt and bite. Occasionally, if he is being a bit rambunctious, I will bring him in the house or put him in the pen or just take him to the other side of the garden. But she doesn't actually seem that bothered.
I've gone for flowers before, but maybe I'll try headbutting.
Headbutting.
Yeah.
I've caught him on top of her a couple of times when we first had them, and then she laid some eggs.
Wow. Wow, you've got tortoise eggs.
We have tortoise eggs.
Oh, my goodness. You can't help but be really impressed that two old-timers are busily getting at it in Simone's garden. So whatever she's got growing here, it obviously works very well in that department.
So they're in here. We have 2 trays. That one has 3 in it.
Wow, that's amazing. Look at that. You can actually see that there is some density in there. So it could be a yolk
Okay.
and a white, just like a normal chicken egg.
Yeah.
But that doesn't mean that it's naturally fertilized. But we know that these guys have been
Busy.
getting on the good foot and doing the bad thing. And as a result, there could be some tortoise babies in there. You never know. Well, they're doing well in this incubator. They're nice and warm. So let's get them back in there.
Lovely.
Good luck, little ones.
All fingers crossed. Hope that we possibly get some baby tortoises out of it.
You've totally got to invite me back when you get the pitter-patter of tiny little tortoise feet.
Definitely. Slightly panic call, no doubt.
Yeah.
Oh, what do I do now?
And I'll check on Atwin's snotty nose at the same
Yes. No, that'd be lovely. Thank you. Well, thank
problem.
you for coming out.
Pleasure.
Thank you.
It's obvious to see that Simone is really dedicated to these tortoises already. She has real love for them. I think she has real respect for them and she wants to do the best by them. So she's the perfect new owner for them and hopefully they'll live a further long and happy life with her.
Hi, Jess. Hi, Phoebe. This is Coco.
Oh, Coco, you all right? What's Coco here for?
Coco's in for her spay today.
Oh, you're so cute. You're so tiny.
At the Richmond Practice, Coco the pug is about to be spayed by graduate vet Phoebe, assisted by nurse Jess.
Girl.
I'm a bit nervous because I haven't done that many spays. I did a few as a student, but since graduating, I've only assisted on one, and this will be the first one, being the main vet making all the decisions.
Look at that. Well done, puppy.
Well done.
Coco also has a small hernia which Phoebe will be repairing.
Hello, ladies.
And Scott has returned to the clinic
Right, you've
to
got
supervise
Coco.
both procedures.
Today I'm here just to lend a hand, to be a shoulder really for Phoebe as she embarks on this big journey of doing her first spay. It can be incredibly nerve-wracking, so I want to try and support her, to look after her and make sure she gets safely through this procedure, and so does Coco. How was Anna this morning? Was she fretting?
I told her she didn't need to be worried and that we take good care of her.
Yeah. Did you tell her how many spays you performed before you said that?
No, I kept that fact to myself, actually.
Well, that's okay. I've done quite a few, so don't you worry.
I know the theory of it and I've learned it 1,000 times, but it's just those tiny little things in practice that are just a bit different, like a bit extra fat obscuring the uterus, a bleeder where I wasn't expecting one, that means you need to be able to react quickly, and that's what I need to hone down my skills.
Go for it.
Jess, are you happy?
Happy, yeah.
Okay.
Every single vet coming out of vet school is incredibly nervous when it comes to their first spay. It makes your heart go. It really does give you palpitations. It's a very nerve-wracking experience, but it's a real rite of passage as far as being a new graduate vet. Okay, so you've got your ovary at the end.
There's my ovary.
Okay. Now, the hardest bit for a new vet is to get used to how much tension you have to apply to break the ovarian ligament. And it's just about trying to feel confident with how much tension to apply to actually snap it. And it's always going to feel like more than you should. Can you feel the tension running up?
Yep, I can feel it stretching now.
Yep. And then you've got to just push down, snap.
Is she okay? Yeah. This is the most painful part of the procedure, isn't it?
For you or for the dog?
Both of us. It's stretching, it hasn't broken yet.
If you grab it, slightly twist your hand to the side, and then you can snap that way. Put that pressure downward, really go for it. Breaking?
Yeah, broken.
That's great, good job. I've seen vets struggle with that for years, so that's really good.
It's a bit nerve-wracking, but Scott was able to give me loads of helpful tips in spaying, and all of those are hopefully going to help me do my next spay quicker and easier.
So if you just start your second incision by just attaching it, just going over the hernia, lovely. Not only is Coco in for her spay today, but also she has an umbilical hernia, basically what we see in humans as an outie belly button. And that's just where the umbilical cord has detached from mum and the placenta. The abdominal wall hasn't closed properly. It leaves a hole and then a little bit of fat, and sometimes intestines can pop out. Phoebe's able to close up the skin really well, so no more hole and no more outie belly button. Done.
Well done.
Well done.
Thank you. Start to finish.
Very good.
Although I was very grateful for your assistance, Scott.
Very welcome. All right, now let's wake this princess up, shall we? Have we got her throne ready? Phoebe's done very well. I mean, this is a very nerve-wracking procedure for any new vet to do. She's jumped the hurdle and she's on her way. Well done. Oh, big stretch.
There we go. The surgery went really well. Coco's recovering. She doesn't have a hernia anymore. She doesn't have ovaries. I think we've done well.
Call your mummy.
In Richmond, it's time for Arnie's second surgery, this time to fix his badly neglected teeth.
Oh, look, who's that? Who is it? Who's that? Hi again. Careful.
Scott's invited Ali back to assist with today's surgery.
He's definitely happier. The wound at the back of his tail here, where we've removed the lump, is healing very nicely indeed. So nice assisting the other day. And even better news is the results have come back. And although it looked like an incredibly nasty tumour, it had the suggestion that it was going to become something nasty, but actually it's benign. So.
No way. Oh, mate. Just a nasty, horrible lump.
Yeah. Oh. More unsightly than dreadful. Yeah.
That's the best news.
Yeah. A little bit of sunshine in our boy's life.
But Arnie's good news is tinged with sadness. After Scott found out the poor old dog is deaf.
Stone deaf.
Stone deaf.
Yeah, he can't hear a thing. Nothing. Hey?
Scott and his team are now more determined than
well.
ever to give the brave bull terrier a better life.
Yeah, relaxed.
So now it's time to start his much-needed dental surgery.
Let's get you downstairs, my boy, and let's sort those teeth out. Although I'd love to give Arnie a Hollywood smile, this isn't a choice. I have to do this dental. His teeth are horrendous. There's a huge amount of bacteria and infection built up along his gum line, which will be having a major effect on not only his quality of life, but also the health of his liver and his kidneys. Hold your dental chart there, please,
Do I not
nurse.
need any gloves?
Well, we might get you pop on some gloves in a second.
Okay. Shall I fill his name in?
Yes, go for it. As Ali's here and she's a hard worker, I'm going to put her to work. So not only will she be my dental nurse for the day and help me to understand which teeth are going to stay and which teeth are going to go, but also she'll do a little spot of scaling and polishing. This is years worth of tartar that we're going to get rid of in an afternoon, which is quite satisfying, yeah.
God, you can be quite rough.
Yep. Doing a dental on a dog like Arnie is pretty dirty business. It's very grubby, it's quite bloody, and at times it's really quite rough as well. We have to put quite a bit of force in to remove some of the teeth that are loose and then scale all the nasty tartar that's been building up over a number of years. So 401 is loose, so that's going to come away.
8 of Arnie's teeth are badly infected and will have to be removed.
So when they come out that easily, they're meant to come out.
His gums are also in shocking condition.
Do you want the goggles?
And a thorough clean is needed to remove years of built-up tartar and plaque that's contributing to his gum disease.
It really must have been such a painful time. Every time he opened his mouth to chew, it must have been an exercise in discomfort. But now all that tartar's removed, just like when you go to a dental hygienist yourself, your teeth feel shiny and fresh, and that's exactly how hopefully Arnie will be feeling. Oh boy, well that's the last thing we need to do. Hopefully you can have a lovely retirement now. Ready for a loving home. Do you know anyone? I'm trying to be very subtle when it comes to Ali and maybe considering that she should take Arnie home with her. I'm not normally classed as subtle. My wife would say I'm like a brick through a window.
But Scott's not so gentle persuasion seems to be working.
He's a lovely boy.
He is, and when he's up, he's such a joy. Tail going.
He's a classic love sponge. Yeah. Hey.
You could share him.
Maybe we dog share.
Yeah.
Gosh. You have to tell Zoe.
Hello, Coco. Time to go and see Mummy. There we go. Should we go see Mummy?
In Richmond, Anna and her 3 boys are anxious to see how their precious pug Coco has fared after her operation.
Here she is.
Hello, darling.
Little baby.
She's been really, really good.
Okay.
The surgery went really well. We managed to spay her and repair the hernia. She's recovered well and she's had some food.
Good girl, you're such a brave girl.
Anna's definitely delighted to have her little girl back in her arms. I think with all the crazy boys around, she needs a bit of sanity and a bit of girl power.
Yeah.
She's going to need some big brotherly love,
Yeah?
okay?
Thank you.
Thank
you very much,
That's
Phoebe.
okay, boys. I'm just glad she's all right.
Yeah, no, honestly, thank you so much.
No problem.
The princess is home and she's going to be treated like a princess for the next few days for sure. So yeah, that'll be easy for me to do. Movies, cuddles on the sofa, just chilling out with Coco and the boys, and she is going to be in charge. Girl.
Good boy. That's it. What a good old gent. Okay, now remember, best behaviour. Hey, mind your P's and Q's.
Today, Scott has brought rescue dog Arnie to a local park.
Walking down the hill with Arnie, immediately I get a little bit nervous. There's real trepidation because this is a make or break moment. Arnie has the chance of a new life with someone absolutely amazing. So I just hope this works, but I am very, very nervous.
Uncle Scott's on his way with a surprise.
Scott is hoping his good friend Ali will give Arnie a new home. But it all hinges on how well Ali's dog Mabel gets on with the old bull terrier.
I can see your potential new family over here. Come on.
My biggest priority is Mabel. I hope the meet and greet goes really well, but I need to be sure that I'm doing the right thing for her before I can do the right thing for him.
Hey, Al.
Hey there.
Who's this handsome guy?
Look at him.
Who's this handsome guy?
Gently.
Say hi.
Oh, look at him. There you go.
Aww. Oh, they're going to do a dance.
We're going to do the lead dance.
Arnie and Mabel lock eyes and love at first sight. Oh, look. I think that's the first time I've seen him do that.
Oh,
yeah.
Are you kidding?
No.
Oh, look. Mabel and Arnie seem to get along brilliantly.
Look at that!
Look at that!
Oh! Immediately, Arnie starts to play bow, which is a exhibition of happiness where they want to engage another dog in play behaviour. That's so positive. They start walking around and smelling each other, which is very normal for dogs. And then they get to a point where they're so comfortable in each other's company that they pretty much ignore each other. That is an ideal result.
That's brilliant, isn't it?
Very calm, very relaxed.
Yeah, I'm really happy with that.
Very happy, waggy tails. We really couldn't ask for anything better.
No.
The look in Ali's face shows how calm and how happy she is about the situation. Looking good.
He needs a good home. He hasn't had one, has he? And I think I can give him a pretty good home.
Yeah.
It feels kind of right.
So happy, so happy. So nice. It might not be for a long time, but it'll be for a good time.
You'll be fed well and loved, sweets.
Yeah, and I'll be there, and you've got a personal physician.
That's it. The meet and greet went brilliantly. So, yeah, I'm really happy. I think he's found a home with me.
You're right there, Mabel. Hey? You're right there. Hey?
You're missing out, darling. Did you just
You're right. You're right there. As Arnie's an old boy, he still needs a little bit more treatment before he's fully ready to go to his new forever home. So he's going to come back to the practice with me, but very soon I get to help this boy as he ventures forth into this wonderful retirement. Happy families.
I hope so.
Right, let's come and find Atwin.
Yes, the obligatory search for the tortoise.
Scott's back at Simone's house to check up on one of his oldest
you?
patients, a
How's that runny nose
100-year-old
getting on?
tortoise with a runny nose.
He's doing a lot better.
Good. Well, his nostrils look nice and clear, don't they, champ? And no discharge, which is brilliant. Good stuff, my boy, hey? Or sir, as I should say, considering how old you are. I'm really glad to see that Atwin is back to full health and looking great. But I'm very curious about the fact that this old boy managed to procreate with his girlfriend and produce eggs. So what happened to them? I'm really interested to know.
Right, come through and I'd like you to meet Maisie and Daisy.
Wow.
These are our little tortoise babies.
Can I pick one of them up?
Yeah, feel free.
Hello, cutie. So which one's this one?
So that one is Maisie and this is Daisy. They're a week old today.
Yeah.
And we had the pleasure of watching them hatch out, which
Wow,
was
really?
amazing. When they were hatching, first of all, it was just a tiny little nose and a little face poking out. Slowly, one came out on its side, but the other one properly came out like a little dinosaur with its front paws first. And it was incredibly cute to watch.
You can do this, little fella.
I mean, they're absolutely fantastic. And to think that they've come from 100-year-old parents.
I know.
It's incredible.
I
isn't
really
it?
didn't think the eggs would hatch. I thought that was a real long shot.
These little creatures are so amazing and extraordinary, and I feel very honoured that I've been allowed to examine them for the very first time. But at some point in their life, they'll be examined by a vet that isn't even born yet, which is a bit frightening, but super cool at the same time.
And if we do everything right, there's no reason why my grandkids or even my great-grandkids might not be looking after these guys.
You guys have got a lovely future ahead.
We absolutely adore Maisie and Daisy. They've really become part of our family. A lot of friends have said, oh, are you going to rehome them and can we have one? It's like, no, they're ours to keep.
Graduate vet Phoebe is in Chiswick to check up on very special patient Coco and her doting owner, Anna.
Hi, Anna.
Hi, Phoebe. How are you?
I'm good. How are you?
I'm good. This young lady's very well as well.
Hello,
aren't you?
Coco.
I'm really excited to see Coco today. It's been a couple of weeks since she came in for her spay and her hernia repair. It was one of the first procedures I did since qualifying, so I'll be interested to see how the spay wound is healing. Right, should we have a little look at that scar then? Oh, wow, look at that. That looks really, really good. Got no recurrence of that hernia. It's nice and flat with the skin.
Yeah.
Yeah, there's no pain, swelling, discharge.
Oh,
No, that's really good. It's completely healed.
amazing.
Well done, Coco.
Having Phoebe come to see us is really important, obviously, because Coco is our fourth child, basically, our only daughter, even though she's canine. And it's just really important to know that she's okay and that nothing's wrong and that she's recovered.
You're all done. You can be signed off now.
Good.
Go back to playing how you want to.
Yes.
It was really great to see Anna again and see Coco. I'm really, really happy with her wound. It's all healed really nicely.
Go!
She can now go back to normal exercise, playing with her brothers and being full-time princess.
Go, go, go! Come on! Good girl. Phoebe made me feel, really happy about Coco's recovery. And I now know that I can take Coco out for a walk and, that she's happy and well. It means a lot to us. Coco, Coco, Coco! Come on! Come on! Good girl.
I will miss you. It's so lovely.
It's a milestone day for elderly dog Arnie. The 14-year-old rescue dog has undergone weeks of surgeries, medication and TLC. And today he's finally well enough to head off to his new home.
Hey guys, I was wondering where he was.
We just kidnapped him.
He's enjoying his favourite pastime of being adored.
Yeah, just making the most of its last few minutes here.
Yeah. Obviously, it's very sad for us to say goodbye to Arnie because we've all absolutely fallen in love with him, particularly some of the support staff, Kirsty and Reagan. They adore him. They've actually taken him on weekends to their own homes and given him all the love and the care and attention that we all pride ourselves on. So it is very sad that they have to say goodbye to him, but for Arnie, it's a great day because he gets to go to a loving new home. Come on.
Come on, then.
Come on, mate. Let's go to your new home. Come on, buddy. Good boy. Good boy. That's it. Come on. There you go. Let's go. Let's go.
Sad. What are you going to do now? I know.
Come on, then. Hey, chauffeur driven to your new home. Come on. Arnie's been with us for a long time now. For him to go to his new home, obviously, is a really important step in his future. But for us, we're left with a big hole. He has been such a wonderful personality to have in the building, and we're going to miss him very much. Hey, mate, let's go. Boys on tour. Yeah?
Big brother's coming today. Yes, he is.
At Arnie's new home in Surrey, an excited Ali is waiting with her other rescue dog, Mabel.
Mabel doesn't have a clue what's coming. But I think when he arrives, she'll think he's going to stay for a bit and then leave. It's just the bond between the two dogs. You're never really sure until, you're in the home environment. There's a tiny little bit of anxiety there. The rest of it is just excitement.
Okay. Come on then, handsome. We're here. There we go. Good boy. Come on then. Come on then. Come on, this is your new home. Hello, mate.
Hello, mate.
Hello, look.
Hello,
your
fella.
New friend. Look.
I know you can't hear me, but hello, fella.
Hello, Here's your new boy.
Hello, fella. God, Scott, he's looking so well.
I know.
You've put on a few, well, I don't know how many kilos.
He's put on 4 kilograms. He's put on 1 kilogram a week. So he's just doing so well. And now you get to enjoy the high life with Ali.
Welcome home, treasure. Hey.
It's an incredible full journey that we've had with Arnie. He's gone from rescue, we've rehabilitated him, had 2 major operations, and now he's going to be released back into the wilds of beautiful Surrey with Ali. He's going to have such a wonderful twilight of his life, and the fact that I've been able to play a part in that is really special for me. Go on, old man. Go on, you can do it.
So he's home. He's home here with us, with Mabel. He seems pretty relaxed. Mabel seems pretty relaxed. That's it. What a perfect day one.
So nice to just see him in a garden alley.
Oh, love him.
I know. He's so lovable. He's so lovable.
I know, he's a good boy. Good boy.
In Richmond, one of Scott's long-term patients is enjoying a few quiet cuddles with devoted owner Sarah.
Badger is our 12-and-a-half-year-old Irish Wheaten Terrier that we've had since he was about 6 months old, and he's been the best dog we could have ever wished for. There isn't a day that goes by that I don't find him dressed as a witch or a fairy or he's just been an amazing part of the family.
But Badger's been battling a massive low-level malignant tumour.
Sore, isn't it?
And despite 2 major surgeries, it keeps growing back.
So we're sort of worried that if it isn't addressed, it's going to split the skin because it really is stretched. And it's like, it goes all the way underneath, sort of almost like a sort of tennis ball size, and then this bit underneath. So it's pretty grotesque. We sort of promised ourselves that we wouldn't operate again. Scott's done both operations previously, and we kind of drew a line under it and went, right, we're done. We're not going to do that again. But it's sort of got bigger and bigger, and, he's relatively happy in every other way, and we're now kind of like back in the situation of, what do we do?
Badge, do you want to go for walkies?
Yeah. Oh, come on, fella. Oh. Come on, boys.
And let's go. Good boy. We've got to go and see Scotty, okay? Come on. Good boy. Got to get you up the hill.
As Sarah heads in to see Scott, she's bracing herself for the possibility that Badger will need a 3rd surgery.
Come on, then. Let's do it.
That's a good boy. Hi, Kirsty.
Hi, Sarah. How are you?
All right, here we are again.
Oh, hello, Badger. How's he doing? All right?
Yeah, he's doing okay, but, the lump's really big now, so I think...
See, can't you?
Yeah, I think it's kind of decision time, so another chat with Scott.
Oh, do you want to take a seat?
Yes.
He'll be right with you. Just let him know you're here.
Thanks, love.
All right.
Hi, Sarah.
Scott,
Hello, Badge. How are you, mate? You all right?
You're a very happy boy today. Goodness me, I can see why you've come in.
Yep, it's not slowing down.
It is not. It's quite monstrous at the moment, isn't it, mate?
All right.
Yes. Oh, was that a bit tender?
Come
oh,
here.
Bless you. Come on, let's keep the happy boy, hey? The waggy tail's what we want. Come on then, Badge, you're gonna come this way? Come to the consult room? Come on.
Boy.
Good boy. Well done. Good lad. Didn't you come? There we go. Well done. So it's been a few weeks since we've seen each other, and unfortunately that has grown, hasn't it?
Yeah, it's definitely, it's not slowing down.
No. And how's he being affected by it, do you think?
Well, I think slowing down, he's not as inclined to sort of go for a walk as much as he was. You can tell it's just really cumbersome and it's awkward. He's finding it hard to find a comfortable spot to sit down.
This is a massive tumour that's really pulling his weight off to one side, which will be affecting his balance, will be causing an increase in arthritic development in the back legs. There's a lot of negatives to this thing, besides the fact that it's stretching the muscles that it surrounds and causing him discomfort.
He still wags his tail whenever anyone goes near him. He still wants to go for a walk, albeit a short one. So I feel like we're doing him an injustice if we just leave it.
Okay, well,
But
let's...
it's a hard decision.
It's a very hard decision, really. It is, and we flip-flop about it constantly whenever we see each other, don't we? This is not the first time that we've considered removing Badger's tumour. It's a slow-growing sarcoma, which is a malignant type of tumour, but it's one that doesn't tend to spread. It just continues to regrow in the same site. Now, unfortunately, the size of this tumour and where it is means that we can't ever remove it completely. So unfortunately, it keeps growing back, and this is now the 3rd time that's happened. So I think what we might have to do is just pop a muzzle on him. All right, champ, it's Hannibal Lecter time.
Yeah, come here, Badge.
Come on. So he's a gentleman until he's challenged, and then he turns into a bit of a beast.
Yes.
Don't you, mate? Hey? No, you just know your own mind, don't you? Yes. Okay, you ready, Sarah? I'm gonna pop him up.
Want me to lift or you?
No, we'll go. Oh, good boy, good boy, good boy. Wow. This tumour is absolutely huge. So to see it coming out from his chest, it's almost like he's got an udder, isn't it? Like it's just...
It's like a cricket ball, isn't it? And it's sort of that hard as well.
Yeah, it's huge. There's positives and negatives.
Yeah.
But I think the thing is that he is a lovely, otherwise healthy family dog.
Yeah.
Except for this. So if I can rid him of this one last time and give him the, old age, genteel life in Richmond that he deserves, well, I think he deserves it.
Yeah.
Yeah.
The worst thing would be for him to not come through surgery. I think, we haven't got a choice now. He's just, he's in too much discomfort. I think we've got to do it. So, yeah, I am worried. Cheerio, Boise. Be good. Come through it. Okay. All right, thank you.
Okay, love to you and the family.
See you later.
All right,
Bye.
see ya. Bye.
Bye.
Say bye, Mummy. Say bye. Oh, I know. You've got to be such a brave boy. Yes, you do.
Can't you?
In Isleworth, John is arriving at the clinic with a lost kitten.
Hi, I've just found this kitten in a bush.
In a bush?
Yes.
Nurse Lily is on reception.
Basically, I dropped the kids off at school, and as I was going back to get in the car, I could hear this meowing in the bush. I had a little rummage around and eventually found her sort of 3/4 of the way up this bush. Just a little ball of fluff, just crying away and a bit dishevelled, as you can imagine. She looked like she'd been stuck there a little while.
So just in a bush on this road?
Yeah, literally just 200 yards down the road there.
What we can do is check her for a microchip and just see whether she's got an owner out there who's missing her.
OK.
If you just hold her for a second.
Yeah, no problem.
The little stray that John has brought in is adorably cute. I think she probably does have an owner out there somewhere because she's in quite good shape and she's very friendly with people, and a lot of strays generally aren't. But if we don't have a microchip, it's going to be really difficult for us to find that owner. But we'll give it our best shot. All right, here we go. So we make sure we check all over because they can move.
OK.
Hey, missus. Doesn't look like she's got one, unfortunately.
OK.
What we'll do is we'll keep her downstairs and then we'll get our vet Phoebe to check her over and make sure she's all OK. As a stray, what we have to do now is keep her for 7 days, and then we put a poster in our window and we'll pop her on our Facebook group as well.
Lovely. Thank you.
Thank you. And hopefully her owner will come forward in that time. If not, we'll start looking for a new home for her.
OK, lovely. Thank you very much.
No worries. Bye-bye.
Any strays that turn up at the clinic are given a full health check.
Hi, Phoebe.
Hey.
Hello.
Oh, who's this?
This is a little kitten who was found in a bush up the road.
What, it was a stray?
Yeah, a member of the public just brought it in.
Oh my God, it's purring.
I know. I think it's a girl, but I'm not sure.
Oh, let's have a look then, shall we? Yes, it's a girl. Yay. She's young though. She must only be about 3 or 4 months.
Lily brings down the cutest little kitten downstairs. I can't believe that it's a stray.
Phoebe is now going to look for clues about the little kitten's age or history.
Little baby teeth.
Definitely young then.
Definitely young.
She also wants to make sure it has no underlying health issues.
Considering that she's literally been fished out of the bush, we'll just give her the full health check over, the eyes, the ears, the nose, checking the heart and chest.
What's that? That all sounds fine. Did you hear anything under all that purring?
Just about. Overall, she's in really, really good health. She's a bit hungry, as you'd probably expect, but that's something we can easily fix.
Yeah, she's already chewing on my fingers.
Let's get you something to eat, Poppet.
Come on then. Phoebe's had a good check over of her and there's absolutely nothing wrong with her. You're very hungry, aren't you?
The little kitten will stay at the practice, and hopefully her owner will be found soon.
What do we think of this? You think that will find your owner?
Hi, team.
Hey, you're...
Hey, yes, so... Badger's back, Nath?
Yes.
He says with a worried look in his eye.
He's a really sweet dog, but just not the best patient.
Agreed, hence the muzzle.
At Scott's Richmond clinic, Badger is about to undergo major surgery to remove the massive tumour growing on his chest.
Reagan, I don't know if you've met Badger.
No, I have not. That is crazy.
Yeah, it's not his most attractive feature. He's a champ. No. Unfortunately, I'd love to say that this is the first time we've removed it, but it's actually our third.
Oh, really?
Yeah, it's a slow-growing sarcoma. It doesn't actually spread anywhere else in his body, but just continues to want to live on this side of his chest. And you can just think how taut. It's so tight, you can feel it.
Yeah.
So it's stretching all those muscles, and that's what's so uncomfortable. That's why you're panting all the time, aren't you, mate? Because you're just a little bit low-level uncomfortable all the time.
Oh.
So this time, third time lucky. Wow, look how vascular it is as well.
With Badger's fur shaved off, the huge scar from his 2 previous surgeries is clearly visible.
Right, here we go.
It's the line Scott is using to go in for a 3rd time.
It has some semblance of being fatty, but it's granular. It just doesn't have any structure. I mean, once you get your finger, look, I mean, it's just soft. Going in to remove this tumour, it is just hideous. It's just everything that you would think would personify cancer. It has no structure to it. It pulls out like kind of wet porridge. There's a lot of blood supply to it as well. It's just huge and it's just horrible.
The nasty tumour is especially confronting for Scott's new nurse, Reagan.
No, I didn't expect it to be, well, I don't really know what I was expecting, but
Not this.
Not this, no.
No,
No, not quite.
Yeah.
20 minutes into the surgery, Scott is becoming increasingly concerned.
Badger's actually losing quite a bit of blood removing this because it's just so vascular. It's within all the muscle layers of the chest, and we can't control it because the blood vessels there's no rhyme or reason to them. They're not growing in the normal way. So I'm just doing my best to remove as much of the tissue as quick as possible. But it's a little bit nerve-wracking at the moment.
After 25 minutes, Scott has removed as much of the tumour as he can safely manage.
I'm gonna pull out, close it up. I've got as much out as I can.
But suddenly...
Have you got a heartbeat?
Badger's condition starts to deteriorate.
Oh yeah, I have got one. It's not very strong.
Yeah, you just need to keep a very close eye on that. Okay, just have a listen that he's definitely got a pulse still. Reagan, put your hand underneath and feel the femoral pulse.
I'm not sure if I'm feeling...
Can you just get James for us?
Yeah,
just go run into pump up the sauce, Jake.
Okay, just have a listen that he's definitely got a pulse still.
At Scott's Richmond Practice, Badger's tumour removal surgery has now turned into an emergency.
Reagan, put your hand underneath and feel the femoral pulse.
I'm not sure if I'm feeling...
Can you just get James for us?
Yeah,
just go run into pump up the sauce, Jake.
With Badger's condition rapidly deteriorating...
Can you just put your arm up there and just have a feel for a pulse?
Scott has called in vet James to assist.
You can't feel the pulse? All hands on deck. I still am in a situation where I'm sterile, trying to complete the surgery because we can't stop the anaesthetic until I've closed this massive wound. So it does mean that I am hog-tied. I can't use my hands, so I need my colleague James to come in and help with the CPR.
He's taking a breath.
That's a breath in.
Yeah.
Right, the breathing is the really important thing, so just keep on breathing for him. Don't stop.
I put him on 2 and just see how it goes.
Yep. Have you got a heartbeat? Can you hear?
I can. Oh yeah, I have got one. It's not very strong.
Is that him then? Let's throw some adrenaline at him. Same dose.
Precious minutes are ticking by. But now, Badger is not responding.
Can you feel anything?
I can't hear anything.
No adrenaline now?
Yeah. Anything?
Badger has now been unresponsive for over 6 minutes. And Scott is forced to make an agonising decision.
Okay. Okay, I'm just gonna call it, guys. Good work, everyone. Okay. It's one of those things.
Yeah, it's surgery, Scott.
Yeah.
You can't really...
Can't leave it the way it was.
No. I think the looks on everyone's faces, I think, says it all. Everyone's completely gutted, and especially Scott.
Okay.
Scott now has to make a heartbreaking phone call.
Oh, hi, Sarah. Hi, Scott here. Hiya. Yeah, I haven't got good news for you, I'm afraid, Sarah. Yeah, he passed away on the table, I'm afraid.
Oh, my God. Oh, what happened? Tell me.
I got probably 2/3 of the tumour out and was just sort of cleaning up the edges before closing. He stopped breathing, and this time I couldn't get him back.
Oh, Lord. I just was so sure he was going to come through the surgery.
So did I. That's why I'm like, I'm so sorry, Sarah. Yeah, she's devastated, as you would imagine. Straight away as a parent, she's thinking about the kids and thinking about the fact that she decided not to tell them before the surgery, thinking that they would worry. And so now, obviously, they're going to be so heartbroken that they didn't get a chance to say goodbye, which is just, thinking about my kids and thinking about that happening to my dog, it would be very hard. So it's a bad, bad day. Yeah. Sorry, mate.
At the Isleworth Clinic, the lost kitten is making herself at home with nurse Alicia. It's been 3 days since the little stray was brought into the clinic, and so far no owners have come forward to claim her. But she does have some unexpected visitors.
Hello.
Hi, I brought my wife in to see the kitten.
Oh, yes, I remember you found her in a bush earlier, didn't
Yes.
you? Okay, perfect. What I'll do is I'll just go grab her for you and you can say hello. Thank you.
What's this?
You look like you're having fun.
We are.
I've got the gentleman who found her upstairs. He's brought his wife in to say hello.
Oh, fabulous. Come this way.
Come on, you've got visitors.
John found the little stray and hasn't been able to forget her.
Here she is.
And he's hoping his wife, Katie, will be equally smitten.
Go have a cuddle.
She's adorable.
So if nobody comes for her and you want her, we can take her out.
Hey, do we want you? I think we do.
But by law, the practice has to wait 7 days to see if an owner comes forward before they can rehome the kitten. So John and Katie have another 4 days to wait.
She's adorable. She's absolutely beautiful. What we call her?
Dunno. What about Smudge?
Are you a Smudge?
I think she agrees.
I think she might.
So it looks like a little Smudge, as she's now called, has landed on her feet with those two, and hopefully they'll be able to take her home if the original owner doesn't come forward.
Hope we get the keeper.
In Epsom, Surrey, Scott's patient Cookie and her owner Millie are doing what they love most.
She means everything to me, really, because I've had her since she was 8 weeks old, and I've just been with her for like 24/7. She's always with me. She's always making me smile when I'm like down. She's just always there for me. She's always happy. I love her very much. What's this?
I've never known a bond like Millie's and Cookie's. They're just together all the time. They're just peas in a pod, perfect together.
But the little Shih Tzu cross has recently developed a worrying problem.
Cookie's breathing's very noisy. When she exerts herself or she gets nervous or worried, she gets, her breathing's laboured.
It's like someone just pressing down on your chest all the time, or something just being in your throat and like stopping you from breathing. And I feel quite sorry for her, because she can't really run around the park as much as she'd want to, because she gets out of breath quite easily.
Diane and Millie suspect there is an issue with Cookie's soft palate, but they won't know for sure till they see Scott tomorrow.
Hopefully something can be done about it to ease her breathing, especially as she gets older.
At the end of a tough day, Scott's at home in Surrey, working on a special project, a chicken coop.
Yeah, I'm really looking forward to having chickens in my house. It's not something that the average Londoner can do, but now we've moved out a little bit further. I've got the space, the kids are gonna love it, and these chickens just desperately need a new start in life.
Scott's getting some rescue chickens, but first he needs to finish the hen house.
Try and get your way through that, Mr. Fox. There we go.
Last year, Scott met a team of volunteers who rehomed chickens.
Hello, girls.
When the birds are no longer producing enough eggs, some of the luckier ones are given away by commercial farms and are then known as rescue hens. After careful health checks, they're then available to be rehomed.
When you think that these poor birds live their whole life in a tiny cage with wire at the bottom, they don't have natural light, it's just an awful existence for them. So I'm happy to get dirty, get stuck in, build them the coop of their dreams. Whoop, whoop. Hey, no. This really isn't a one-person job. There's a nurse when you need them. Mate, you got some screws? Oh, good boy. Good helping. That's it. Do you want to help Daddy put one in?
Yeah.
Oh, it's looking pretty good. JJ, what do you think?
Hi, Scott. Hi, Jackson.
Hey, Ali, how are you?
I'm all right. How are you doing? Looking good.
Good. Yeah, what do you think?
Scott's also been spurred on by his longtime
I'm pretty
friend
happy
and
so
neighbour,
far.
Ali.
What do you think, Jackson?
It's looking good.
Yes.
I've known I wanted to get chickens for a long time. I mentioned that to Scott, and he said, oh, you getting chickens, I want to get chickens too. So we've decided to go and get chickens together.
Ali has already set up her chicken coop and has come over to give the Miller boys a helping hand.
I think an extra pair of hands is always useful, but a 3-year-old with a power tool is not always that helpful.
You know, as much fun as it is building with a toddler,
I can imagine.
I could do with some adult supervision.
I don't like blowing my own trumpet, but yes, I've built enough flat pack in my time to know that I can follow those instructions, unlike Scott.
I'm a bloke, I don't need instructions. Ali and I are good mates, and we forged our relationship over a long time. It's so much easier doing it with another adult. But she's also a strong-willed lady who knows her own mind.
So that has to do that.
Okay, good.
Good.
Solid. Happy?
Feels pretty solid, yeah.
Yeah.
The proof is in the roof, I guess.
I think our little girls are going to be all snuggled up in there. Hi, baby. This is our new chicken coop.
With
See
the
this
chicken
here?
coop nearing
What's this?
completion, all that's needed are the new residents.
Why?
Getting quite exciting. It's only a few days away, so yeah, the girls are coming. Can you live with that?
Done?
Cool!
Hooray! Yes!
Goes! High five!
Oh, wow, it's so nice, isn't it?
Diane and her daughter Millie have arrived at Scott's Richmond Practice with their noisy companion, Cookie.
Hi
Hi.
Hi, how are you?
Fine, thank you.
Good. Is this Cookie?
Yes.
Oh, hello. She's absolutely beautiful, isn't she?
I'm hoping that Scott will be able to help her breathe and hopefully from then on, she won't have a problem.
Hello, guys. How are you? Hi, I'm Scott. How are you?
Diane.
Hi, Diane.
Hello.
Millie.
Hello, Millie. And who's this?
Cookie.
Hello, Cookie. You're looking very comfortable in there. That's a very funny noise. Let's hope that's just you snoring. Is it? All right. Do you want to come in the consult room? Come on.
She means the world to me, so I'm a bit nervous.
So why is she here today?
You can hear she has trouble breathing. She's got this noise at the back of her throat, which we think is a soft palate.
That is an incredible noise. So the first thing I can see is she has virtually no nostrils, very tightly positioned nostrils like that. So that's why she probably has to open her mouth to breathe. Just have a little listen to your lungs. Well, I can still hear the noise, but it sounds far away, which means that the problem isn't emanating from the chest, it's further up, as you guessed.
Yeah.
So, I think that you are bang on in your diagnosis. I do think it's almost certain to be a soft palate issue. So basically that's the structure that separates your nasal passages from your oral cavity in your mouth. And it's like a big, thick tongue that sort of flaps in the back. And in some dogs that have shorter noses, like little Cookie here, it's all shunted into the back. And then that flaps over her larynx, and then every single breath she takes in comes in and it goes like that over the larynx, and it's sort of flapping like a curtain in an open window, and that's the noise that we can hear. Dogs with this particular syndrome, which is called BOAS, which is brachycephalic obstructive airway syndrome, can be under real duress when it comes to exercise or when it's hot and they're running out and about, say in the park, and they can literally suffocate. So what we need to do is to perform surgery ASAP. Cookie could really be in a lot of danger, so we do need to address this problem now. Your little princess is going to need 2 little bits of surgery today, all right? First off, we need to make her nostrils bigger, and then we need to shorten that curtain, all right? It's flapping over her airways, all right?
It's really scary because she hasn't really been under anaesthetic that much and you don't really know.
You okay? You're a bit worried, aren't you? Yeah. All the animals that come into the practice are loved, but you can really tell there's a very close bond between Cookie and Millie, so I'm definitely not going to let her down today.
Thank you.
All right. Say goodbye.
I'll see you later.
Say bye. And hopefully, when you see her again, she'll be making less noise. Say bye. Say bye.
She's very special. It's sort of unimaginable, isn't it, to be without her? So, yeah, it is worrying.
Hey? You sound like me when I'm asleep. Hmm?
In Isleworth, it's now been 7 days since John found the lost kitten.
Go on then. In you go.
And he's back today with wife Katie and daughter Parker.
Hello.
Hi.
I do believe she's yours. Finally. Do you want me to go get her for you?
Yes, please.
You excited?
Very.
Go get her.
I'm very, 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 very excited.
How are you? It's been 7 days and no one's come forward to claim her, so it looks like Smudge is definitely Katie and John's. They look so excited. Here she is.
Hello.
And I think little Parker could hardly contain herself.
Look, it's your new kitty.
Finally we get to take her home. Been worried all week that someone was going to come in and ring and say that she wasn't ours, but now she is.
Very exciting.
She's so cute. I'm going to kiss her.
And kiss her nose.
Yeah.
I think Parker and Smudge are going to get on very well. I think we're going to have friends for life.
She's very, very excited to get this cat home and give it lots of cuddles and play with it and introduce it to the dog and the cat. Are you happy now?
Yeah. It's great to know she's going to a loving home.
She'll be a welcome addition.
Bless her.
Wow.
It's going to be a shame for us not having Smudge here. She's kind of settled in brilliantly over the last 7 days, and it's going to be odd coming to work and not seeing her. But having her in a family environment is what's best for her, and it just wouldn't be fair to keep her here just for us.
Say bye to Lily.
Bye.
Bye-bye.
Thank you. Bye.
Bye.
Should we take her home then?
I don't want to use her.
Come on, Em.
Sweetheart. Good girl. Okay, thumb on. So nearly done, sweetheart. Good girl.
In Richmond, Scott is hoping surgery will help give Cookie a better quality of life. Nurse Nathan will be assisting.
Hey? Yes.
Cookie has small nostrils, as well as an elongated soft palate that is obstructing her airway and causing her constant snorting.
Brachycephalic obstructive airway syndrome is the problem, and the solution is not only increasing the size of her nostrils, but also reducing the size of her soft palate, which will reduce the noise and hopefully make Cookie breathe easier.
Hey.
Hey.
Right.
Hi. How's it going?
Going good. How are you doing?
To perform the surgery, Scott will also need the help of new vet Phoebe.
I'm going to do, Phoebe, is just going to place some stay sutures that you're going to hold behind my head so we can both see what we're doing. With that hand, if you hold on there we go. Okay, good.
As well as a new vet, Scott's also using a new piece of technology for today's surgery.
So what benefit does this new bit of kit give you?
Well, it's incredible, really, in that it cuts using radio waves, high-frequency radio waves. Today, I'm very excited about our new toy, which is radio surgery. It basically uses high-frequency radio waves to cut through tissue. It also clots the blood as you cut it, and then you're able to remove the tissue altogether. So it's a very clever bit of technology, and it basically flies through a probe that I hold in my hand, just like a water scalpel. So it's quite a meaty one for a little dog. Here we go. Yeah, well, I mean, I think my kit worked really well, although the smell...
It's not great, is it?
It's not barbecue fare, is it? But that's actually cut that beautifully. Can you see that? Good.
It's not bleeding at all.
You're right back there, Phoebe.
Yeah, I'm all right. Just leaning on you for support, as usual, whilst also being a massive weight on your shoulders.
Okay, so let's let those stay sutures go now, Phoebe, and see. That's it. Good. Look at that.
Right.
Staying there. Beautiful. After trimming the soft palate, both Phoebe and I can see very clearly down the back of the throat that that soft palate is no longer going to be the cause of that reverberation, that noise, which is great.
It's really good.
Yeah, pretty happy with that.
Life-changing.
Hopefully it will be, yeah. All right, let's move on to the nose then, shall we? The next procedure I need to perform is basically a nose job on Cookie to increase the size of her nostrils, and that's called an alarplasty. So what I do is take a little wedge of tissue from each of the nostrils and then flare them open, increasing the nostrils, increasing the amount of air that she can breathe, and reducing the noise she makes. Okay, it's amazing. And the lack of bleeding is really quite awesome. Okay, so let's suture that one. Look at that instant nostril. Okay. Yeah. Okay.
Oh, that's so much better.
All right, let's wake her up and see if she has stopped making that awful noise. Hey, what did I say? That's the moment of truth. All right, sweetheart. Good girl. There we go. There we go. Oh, hello. Listen to that. Happy with that. Eh? Yeah. Looks good, sounds good. Yeah. The proof really will be in the pudding when it comes to Cookie recovering from her anaesthetic, because the tube's been down her throat, so we know there's a bit of throat clearing, there's maybe a little bit of fluid in her nose as well, and a bit of irritation to her windpipe because of the tube. All of that adds up to being far less than the noise she made before we started, so it's a great result.
Once Cookie fully recovers from the anaesthetic, Diane and Millie will be back to collect her later this afternoon.
Rest. Okay.
Hello, baby. Hello. Hello, sweetheart. Hello. Listen to you, eh? Oh, what a lovely, quiet girl you are.
In Richmond, little Cookie has recovered from her soft palate surgery.
Come on then.
And has been given the all clear to go home.
That's it. Look, here's your bag. In you go. Good girl. It means home, doesn't it? Good girl.
Scott used a special new cutting tool for Cookie's surgery, and vet Phoebe has wasted no time getting in some practice.
Hello. What are you up to?
Just practicing.
Wow, what's your patient's name?
Porky.
Porky. Wow, you're doing a very nice job on Porky.
Well, you've got to start somewhere, haven't
You
you?
do. Practice makes perfect.
Practice makes perfect.
She'll be pleased to see you.
I can't wait.
I know. Were you worried today?
Yeah.
No, so was I.
The day went by so slow.
I know.
Upstairs, Cookie's owners Diane and Millie are eager to collect their little girl.
It was a pretty horrid day. I had to sort of, keep myself occupied and, try not to worry and be positive. And I'm a bit apprehensive to see her and find out how she's coped with it and, just see how she looks and how she's acting.
Hello.
Hello.
Here she
Oh,
is.
hello, baby. Oh, look, you've got purple stitches.
She's got new looking nostrils.
Are you all right?
Let's just have a listen. What do we hear?
Silence.
The sound of silence. Massive difference, eh? So the first thing that we did is had a look in the back of her throat, and just as I suspected, that curtain was right in front of the open window and just sort of being sucked back, and that sort of vibration was making all that noise that we could hear. So that got trimmed. Then the second thing, as of course you can see, she's got slightly different shaped nostrils now. By just giving that increased aperture, you can see that she is just making far less noise.
That's great, isn't it?
Yeah. You're happy to have her back?
Yeah, we couldn't wait, could we? Couldn't wait to get her back. The recovery is incredible. You can't hear her heavy breathing anymore. She's come through it okay. Yeah, she looks great. Just a bit of TLC now and she'll be fine.
It's going to be really quiet. I won't have to put headphones in to block out her snoring anymore.
All right then. Bye-bye, beautiful. What a sweetheart you are. Back to mummy. Here you go.
Thank you.
You're very welcome. Handing Cookie back to Millie was a wonderful moment because you could really see that she was just so happy to have her little companion back. And for me as a vet, it's really rewarding because I know I've done my job to ensure that Cookie is going to breathe beautifully and healthily a long way into the future.
Bye.
Bye. Go.
Let's go get the girls.
It's the weekend, and Scott and his neighbour Ali are picking up their rescue hens.
Hi there, you must be Fran.
Hi,
How
I'm
you doing?
Fran. Nice to meet you,
I'm Scott. Yeah, and this is Ali.
Hi, nice to meet you. How are you doing? Like you girls?
We're very excited. We're not. We're excited.
Do you want to follow me? I'll lead you the way.
Excellent.
This is one of the collection points for the British Hen Welfare Trust, where the public can come to get hens for rehoming after the birds are no longer productive enough at commercial farms.
Oh, bless you. Hello.
Hello.
Okay, should we start grabbing them out? Yeah.
But first, all the birds have to have health checks.
There will be 150 chickens here, sort of all needing to have a once-over, have their claws clipped, etc. So it'll be great that Scott and Ali can help us do that.
Come on, sweetheart.
Good girl.
Go that way. There we go. Good girls.
You right?
Off you go, girls. Come here, sweetie. There we go. All right. Okay. All right. Okay, baby girl. birds that have been in a caged hen environment have feather loss. They've also got very floppy combs. And some of them are quite lean, which maybe means that they were just a little bit more picked on than some of the others. So they were at the end of the food queue. Right, let's have a little look at you. So first thing I noticed there, she's got this very pale comb flopping down like that.
That's really common, yeah, but that will shrink and it will go bright red once she's sort of cooled down a bit.
Yeah.
Just because it's so hot in the
cages.
Bit
of sunlight.
Exactly,
good
yeah.
diet.
It'll do her good, yeah, definitely. She'll be right as rain.
Okay, let's have a little look at this girl here. Whoa, okay. Let's have a look at your nails. So yeah, they're quite long,
Very
aren't they?
pale legs. These birds shoved into spaces that are too small with no natural light.
There you go, sweetheart.
Their feet are on wire their entire lives. They're dumped at 72 weeks because they're not laying as much as they need to lay. You know, they're just effectively a living machine. That doesn't sit comfortably with me.
Ali, do you love this one? I think this one's your first chicken.
Bless her.
Okay. Ali's definitely got her eye on this one. It's because Ali's had her first chicken cuddle and she's smitten.
No, sweetheart. I just want to give him a good home, really.
Okay, so she can go down. Once we've examined all the birds and they all seem to be in pretty good nick, Ali and I get to choose chickens, which is very exciting indeed.
Lovely, well done.
It's like my Rocky moment. I've got you. You're definitely coming home with me after that.
This one's very talkative. I think she'll suit my household very well. Oh, good girl. That's three. Three more.
So these girls don't really know how lucky they are. As soon as they get home, they'll be sunbathing for the first time, standing on grass for the first time, laying their first freedom egg, which is amazing. So they've got just a whole free-range retirement ahead of them, and they're going to be really, really happy.
Hello. You're home.
Scott is dropping off Ali and her hens first.
I'm hoping they'll settle in pretty quickly.
Yeah?
Right, sweetheart.
Say hi to Mummy.
Hello, me. I want them to have a very different life. I want them to have fresh air and the sunlight and freedom and the best food you can give them, all the stuff they're going to love. Welcome to your new home.
Some more females enter the ranks of the Miller household. You come to welcome the girls. Come on then.
And now, Scott can introduce his new arrivals to their brand new home.
Come on, there you go. I'm really chuffed at the whole process, actually, and to finally have the girls here and to know that they're safe and happy and well. It's such a wonderful feeling. Look, sunshine and a tree. I know those furry things down there are dogs. And you're going to meet a few more people soon. Hey? Come on then. In you go. You guys have a nice little rest. A few more important people for you to meet. Yeah? Look. Who do you think's going to be in here, JJ? Look. Yes. Do you want to meet them? Look.
The new arrivals are settling in well, and Scott is excited to introduce them to the family.
Cute. They are very cute, aren't they, mate? Very cute. I've already called that one. That one's Eggy, that one there.
Eggy?
That's Eggy there.
Okay.
Yeah.
Did
And
you
then
see
the dark
that
one
one?
that's Chuck Norris there.
Daddy, look!
Oh, wow, one's gone out. Yay, that's Hey Hey. It's always special to rescue animals, but to know that they wouldn't have been alive if it wasn't for us taking them to our new homes is just such a wonderful feeling.
That's Pasta. Hi, Pasta boy. It's a girl. Hi, Pasta girl.
Yeah. They need to be girls to lay eggs.
If they were boys, they'd wake you up at 5 o'clock in the morning.
That's true.
Like you do.
Just introduced the chickens to the kids and they think they're wonderful and they're so excited for them to be here. It's just such a lovely additive to the family and also the end of the journey to have the girls here and to have them comfortable and happy and they're already eating and pecking around. It's a really good result, so I'm ecstatic.
And 3 weeks later, Scott is checking up on little Cookie.
Hello! How's it going?
Fine, how are you?
Good. Hello, beautiful. I've been looking forward to seeing you.
Come on in.
Thank you very much.
The Shih Tzu Cross had nose and soft palate surgery to fix her constant snoring and breathing difficulties.
Well, first things first, let me see this beautiful face. And she has nostrils. Look at those. Big difference,
Yes,
eh?
huge difference. I'd say she's about 80 or 90% quieter.
Wow. Straight away, you can hear that she sounds better, she's far quieter, which means that Millie gets a good night's sleep.
Less noise, more energy. Huge difference, yeah.
Gosh, that is incredible, isn't it?
She's a different dog. She just enjoys her walks so much more. And she sniffs, she stops and sniffs, which she never did before, really.
Really?
Yeah.
She's found a sense of smell.
Yeah, it's really different.
Which is just awesome. It's the icing on the cake, isn't it? Ooh, look who's in today.
I know. Oh, Carol.
Our Carol, soon to be Phoebe's Carol.
Is there something I should know about Carol?
At the Isleworth practice,
Hello, love. How are you?
Oh, I'm okay. How are you?
Scott,
good. Who have you got for us
Phoebe,
today?
and receptionist Gina are about to begin a challenging day with one of the clinic regulars.
All right, let's have a look, eh? Hello. Oh, hello, Willow. And then we got Shimmy. And Harry's in the back. Okay, well, I'll take Harry because I need the muscles. You girls get those two. I always love it when Carol comes to town. When she comes into the practice, she always has multiple cats. Carol, who's been eating the pies? Harry has.
I wonder. I told you it was heavy.
They're all crazy. They're all strong-willed. They're all very feisty, very much like the lovely Carol herself. Right. No cigar for working out what his problem might be.
Yeah.
The first patient is Harry.
Harry's definitely the biggest cat I've ever seen in my entire life. I was a bit worried that he was going to break the scales at one point.
What I'd probably say, Carol, is that whenever a cat is sort of covering the whole weigh scale, that might be bad. Basically, he is quite overweight.
Yeah.
So I think the big thing with him is put all the other cats' food up so you know what he's eating, because it's the only food that's on the ground.
I never thought of that. That's a good idea. Yeah, okay.
And what it might do is encourage him to lose weight and be more athletic, because then he'll be able to jump up eventually and get the food. If he's food motivated, hopefully the motivation will lead to weight loss because he'll just be a bit more energetic. With Harry, he lives in a multi-cat household. It's really hard to control the portion sizes of each cat. Harry is just sitting beside the bowl and absorbing everything that's left. And as a result, his waistline is getting bigger and bigger. He's getting more lazy and therefore putting on more weight. All right, so a diet for you, my friend. Next cab off the rank is Shimmy. Out you come. There you go. Unfortunately for Shimmy, she's got quite a long coat, and every year she suffers in the heat, she sweats and then produces mats. And because of her feisty nature, she won't let Carol groom her. Maybe what we'll try and do is just see if she'll let us just hold her and clip it off. What do you think?
It's entirely up to you. If you want to dice with death, feel free. But I'm going to stand right over there, right out of the way. I'm telling you now.
Shimmy's skin is suffering as a result of this matted coat. So as a result, we need to clip it all away. But to do that, we need to give Shimmy just a whiff of gas. She'll be asleep just momentarily whilst that hair is trimmed away. So we're going to keep her. And last but not least, Willow.
Come on then, Willow, coming out.
The cat that comes out of the last box is Willow, who is my personal favourite. She is so adorable. She's a really, really sweet cat. It's a little alien cat. Hey? Carol and I have known for quite a while now that Willow is suffering with a viral condition called calicivirus, which is one of the cat flu viruses, and it leads to a cat having really severe and ongoing gingivitis, which is inflammation of the gums. So with Willow, unfortunately, it's not something that she will ever be able to get rid of.
Okay.
What we need to do, as horrible as it sounds, is to actually remove every single one of her teeth.
Will she be able to eat properly without her teeth?
She'll be just fine. Bone underneath will still be there. She'll be having gums that are nice and healthy now, and she'll be able to eat no problems.
Willow's teeth are really, really painful, and I'm definitely with Scott that the best thing to do is just get them all out now. It's safer for her. It means that she won't have to undergo multiple anaesthetics in her life, and it will just make her a lot more comfortable.
Good girl. I'm pretty concerned about Willow. She's so tiny, and to have an anaesthetic when she's so tiny, it's very precious. She's the one I keep an eye on most. Good mummy's girl.
It's nice with the rowers along the river.
In Richmond, Claire's morning walk with her daughters and the family's 2 Boston Terriers isn't as pacey as usual.
Come on, look, walking's fun.
Recently, 4-year-old Morticia has been struggling to keep up with big brother Gomez.
Good doggies. Both dogs are very active and walk about 6 miles a day.
Gomez, come here.
But I think there's a problem with Morticia because she's been walking in a slightly ungainly fashion, which is really quite worrying.
Oh, she looks tired.
And Frankie, in particular, is struggling with the idea that Morticia could have a serious problem.
Our bond is so unique because they came into my life when I really needed cheering up.
5 years ago, Frankie suffered a brain hemorrhage, and Gomez and Morticia were brought especially to help her rehabilitate.
While she's in her coma, which is for a month, I said to Maxine, her sister, do you think it would be a good idea if we got doggies? So I found a breeder and I ordered 2 Bostons. She loved them.
In the early days, walking was challenging for me, and walking was also challenging for them, so we were kind of in the same position. And so we both walked quite slowly. And then as they progressed to walk faster and start running and stuff, it sort of made me want to walk faster and sort of progress my walking as well. So I think they pushed me to get better faster.
Little tissue woo-kids.
With Frankie's health ordeal behind her, it's now Morticia who needs help. She's booked in to see Scott later today.
Oh, good girl.
Right, should we get an IV in her then and get cracking?
I think so. All right, you hold our little lady for us. That's it.
At the Isleworth practice, Scott and new vet Phoebe are preparing Devon Rex Willow for surgery. Scott has no choice but to remove all the 2-year-old cat's teeth.
Oh, baby. Willow's got really bad gums, classic of gingivitis as a result of being a calicivirus carrier. With Willow, that will never get better. And what we want to do is to try and avoid pain long term. And the way we're going to have to do that is by removing all of her teeth. So it seems like she's fairly stable on this anaesthetic. Breath is pretty pungent, my love. Eh? Okay, so I'll start by removing the teeth on this side and you can have a go on the other side.
Okay.
Next door, Willow's housemate Shimmy is also being anaesthetised by vet Tina and nurse Gina, not for surgery, but for a much-needed haircut.
We're going to do a line cut today, so short back and sides, fluffy tail and fluffy face.
The feisty feline refuses to be groomed, so her thick coat has become matted and knotted. Meanwhile, Scott has removed the first set of teeth from Willow's jaw.
So that's that side completely clear.
My turn. Thank you.
Now it's new vet Phoebe's turn to attempt the challenging procedure.
When I finally give over the reins to Phoebe, she is a face of concentration. She's working really hard, putting that pressure on to get those teeth out. And soon she realises that even though a dental seems like something quite easy to do, it's actually quite tricky. It's just about being very methodical and gradually keep going around, breaking down more and more tissue, gently but purposefully. It's tough, isn't it?
Yeah. At the beginning, I bit off a bit more than I could chew, I think, and I tried to tackle a really big tooth, which didn't really go to plan. I've never had to extract what are basically healthy teeth before. It's a whole different ballgame.
It is.
Oh, I don't know how you do it. It's still so firmly in there. Oh, I don't know how you do it. It's still so firmly in there.
At the Isleworth practice, new vet Phoebe is struggling to remove the teeth from 2-year-old Willow.
I'm breaking a sweat. I think the tooth's winning at this point.
Fortunately, I think it is. This type of dental procedure really can be quite fraught because you do have to give a lot of pressure to remove some of these relatively healthy teeth. And one slip in the wrong direction, you can harpoon the nasal passages, you can even lobotomize a cat or break their jaw.
I think I must not be getting the angle right.
Just lots of patience.
Just got to go slowly.
So and then just sort of try and wiggle into the pocket. Give it a little wiggle. There you go.
There we go.
Hey! Possibly the smallest one in the cat's mouth, but
It doesn't matter, it's still a 2.
That's right. It's really a special time working with Phoebe in this early part of her career because everything's a first, so everything is brand new and really special.
There we go.
Hey! And so, of course, doing a dental like this, it looks easy maybe when someone more experienced is doing it. When Phoebe takes the reins, you can see it's actually quite tough. Hey!
There we go.
There you go.
All done.
That's your first complete dental extraction done.
First time I've removed all the teeth in a cat.
Yeah. Not particularly elegant procedure, but one that was sorely needed.
Good practice as well.
Yeah.
She looks good.
Next door, Willow's housemate is getting the finishing touches to her new haircut.
I think it looks pretty good.
She's looking much better.
It is. You could make another cat out of that, couldn't you?
It's one of those no pain, no gain scenarios. Pain in the short term for a long-term gain.
2 hours later,
here's your girls.
Oh, my word.
Carol has arrived at the clinic to collect her precious cats.
She's still a little bit sleepy.
She doesn't have any teeth.
I'm not kissing you.
Unlike this one. Here's the unveiling. You ready?
Go on then. Oh, look at you.
I know. Fancy, huh?
Got rid of all those knots. Shimmy. Go away, she says. I'm not coming to you. Let's hope her demeanour lasts now that she's been clipped. Shimmy looks really nice. Won't last long, but she does look nice at the moment. And she's happier, hopefully. We'll find out when we get home. Hello.
She's such a brave little thing. And I'm just going to quickly show you her new mouth, okay?
Willow will be much more comfortable now that she's had all her teeth removed.
All right, so a little bit of blood in there, which is completely fair enough, but that'll come right in a few days' time. But she's been a very brave girl. She's been a good girl. Yeah.
Doesn't matter if she's got teeth or not. Willow is Willow, and that's it. Part of the family. Yeah, did great.
So shall we help you to the car?
Give you a bit of peace,
All
yes,
right.
please. Thank you.
Come on then.
Okay.
Come on, you two.
All right.
At the Richmond clinic, it's an exciting morning for Scott and the team. They're getting ready to welcome back an important member of the practice.
We first met Ryan as one of our clients when we first started these practices. A very warm, friendly guy, absolutely loves his animals. And then after a while, we offered him a job. He took it. He came on as one of our receptionists and then worked so hard as a mature student to get into university. And now he's studying as a vet. We couldn't be prouder. Here's the boy.
Hello.
Hello, mate. How are you?
How are you?
Today, Ryan's returning to undertake work placement as part of his veterinary degree.
Very good. How's the university treating you?
Fine, yeah, really well. Really good, thank you, yeah.
Oh, we're so proud of you.
Bless you.
It's amazing, isn't it?
It means a lot to be back here. Scott and the team have done so much for me. I'm so happy to be a part of the team again.
You ready for a few challenges?
Yeah. Put me through my paces.
Go and put the uniform on like Superman and get stuck in.
Get stuck in?
Yeah.
All right.
All right, mate.
Okay.
Good luck.
Thank you.
He's gonna need it.
Good doggies. Boy.
And Ryan's first patient is not far away. Claire has arrived with her 2 Boston Terriers, Gomez and Morticia. She's worried 4-year-old Morticia may have a problem with her left knee, and she's hoping to get some answers.
Hello, Claire.
Hi.
Hello, Morticia. Hello, Gomez. How are you? This is Ryan.
Hello, hi.
That's Morticia, who's our patient. I've seen Morticia quite a lot over the last few years, and 2 years ago she had an issue with her knee. She had a diagnosis of a dislocating or luxating patella, basically where the kneecap pops out of the groove that it sits in. Claire and I made the decision to go ahead with surgery. We got a great result, and 2 years later, unfortunately, the other leg is starting to show similar signs. So, Ryan, you might feel a little set up right now, but Claire and I know what the issues are with this dog.
Okay.
And you are on a journey of discovery, my friend.
Right, okay.
All right. Come on then.
Come on, Tishy.
Come on. In the early stages of your veterinary career, it's a lot of theory. So I think it's the perfect opportunity to put him through his paces as a trainee vet to see what the examination is like, what that shows up, and then what Ryan's diagnosis is.
So tell me, what's been going on?
Morticia has a little problem when she runs. She skips a little bit.
Right,
Looks
okay.
quite cute, but it's not a normal
No.
run.
I guess importantly, which leg have you noticed this on?
Oh, we're giving away so much. I don't know if we should say.
I already knew.
Oh, sure.
Yeah.
With your X-ray vision. It's amazing what they teach them at uni these days. Unbelievable. Okay, well, I think it's probably about time. All those questions are lovely, but I think you probably want to put your hands on the dog.
I do, yes. Absolutely.
Come on, little Tishy.
Oh, sweetie, I've got to get a bit closer, I'm afraid.
During the examination of Morticia, you can see that Ryan's a little bit nervous. He's a little bit tentative. He doesn't want to injure his patient because he is inexperienced, and that's all fair enough. But he is being methodical. He checks each one of the legs and the joints of each leg as well before coming to his diagnosis.
So it would appear that that's slipping out of place.
Yeah.
So Morticia has a luxating patella?
Exactly. Yes.
Little girl.
Morticia's problem is that she has something called a medially dislocating patella. So basically her kneecap pops out of the groove that it's supposed to sit in and moves towards the center of her body. By doing so, it stretches the patella ligament, it's uncomfortable, and it means that the dog skips when she's at the park. Unfortunately, we need to go for surgery because that constant rubbing all day, every day, you will see arthritic development, and that will then impede her lifelong ability to enjoy the park, which I know she really does.
She does. She loves it.
So we need to ensure her future by doing surgery in the present.
Okay. Oh, little Tishy, poor doggy. I don't really like the thought of an operation and anaesthetic. Not good for her to have to be operated on, but at least it will save her from pain later in life.
So, little lady, you're going to stay with me and Uncle Ryan and correct this dislocating kneecap once and for all. All right, say goodbye to your brother. Look, he's
Let's
quivering
go.
and he's not even getting surgery done.
Come on, Gomez.
All right,
Little
see you
boy.
later.
Thanks.
Bye-bye. See ya.
Bye.
Bye.
Come on then. Come on, get your dinner. Come on.
In Isleworth, one of Scott's regular patients has an all-too-familiar problem.
Good boy.
Dylan is a 4.5-year-old English Bull Terrier who adores his food. And owner Jane admits she finds it hard to say no.
I think by giving them extra treats, I think, yes, you do. You feel that because you love them and you want them to love you back, so you do tend to give them little extras, which we shouldn't. One more. Good boy. He's sitting there looking at you, thinking, yeah, go give me some, Mum. But yes, I think it is a love thing. I think because you do love your animals and you want to feed them.
Piling on the pounds can cause serious medical issues, as Jane knows all too well.
Being overweight, I've had some very bad times with my back, my neck, my shoulders, my breathing. You know, even just going up and down the stairs, I'm out of breath. And obviously that is not what I want for Dylan.
Jane has her weight issues under control, and now it's Dylan's turn to count the calories.
I think it is very important that Dylan needs to be checked for his weight.
Dylan is booked in to see Scott, and Jane's hoping he'll help her dish up some tough love.
All gone. All gone.
Hi, Reagan.
Hi.
Ryan's going to tell you what problem Morticia has.
So Morticia has a luxating patella?
Oh.
Yeah.
Which knee is it?
Her left.
Her left, okay.
At the Richmond Practice, Scott and trainee vet Ryan are preparing Morticia for her knee operation.
All that rubbing long-term leads to arthritis, and there's nothing that your vet can do about it.
No.
So that's why it's better to prevent the issue or nip it in the bud.
Vet nurses Reagan and Sam will be assisting.
Good girl. Well done. So what we need to do is to give her an anaesthetic. we'll get on with the surgery. All right? You're a good girl, aren't you? The condition of medially dislocating patella is something that we do see quite commonly here at the practice, where bow-legged dogs are having their knees pop out of the joint. So out it pops like that, see? Put your finger there, you can feel the groove. And then just beside it, you can feel the kneecap.
You can, yes.
Okay, now push it back.
Wow.
Feel gross?
Yeah. Yeah.
Yeah.
It's disturbing.
Yeah.
Yeah.
And that's what we're going to fix.
Okay.
All right. Flush a bit of oxygen into there.
This will be Ryan's first chance to scrub in for a surgery. Scott will be mentoring him every step of the way.
Ready?
Okay, let's go for your first surgical experience.
I'd always wanted to be a vet. It's great to be able to come back as a vet student and prove myself, really. I know that Scott's going to really push me, and that's great for me.
All right, so Sam, you happy?
I'm happy.
Yeah, all good? Ryan, you happy?
I'm ready. Let's go.
He looks nervous. Okay, so I'm just going to cut now. Okay, Ryan, so what you can see there is that trochlear groove where the knee should sit, okay? And what's the first thing you can see looking at that?
Well, there's a distinct lack of the groove.
Yeah, it's pretty much flat.
Yeah.
Exactly. So what we need to do is definitely deepen that to allow the knee cap to sit in that groove. So this is the saw that we're going to use to cut a little hole into this trochlear groove.
Deepen that groove, okay.
Yeah. Just support this.
Yeah.
Be nice and still and possibly watch your own fingers, all right?
Okay.
Now, this is the all-important bit. How you feeling doing this?
Yeah, fine.
Yeah? It's not making you feel nauseous or weird?
Not in the slightest.
There we go.
Okay.
There's a lovely wedge. That's our little friend that we'd keep for later.
Safe.
Okay, so now, what we need to do is deepen that about 2 millimeters, which doesn't sound like lots, but for a little dog, that is going to be quite a bit. So now, I'm just going to replace a bit of cartilage from before.
Okay.
Back in. So that looks pretty good. So we can place the knee back into that position. There we go. We can see that's now sitting there, back where it should be.
Okay.
All right, so let's close her up. I'm really happy with the surgical result with Morticia. She should be walking around perfectly after about 6 weeks or so. So it's very rewarding indeed. And that, my friend, is your first knee operation in a dog.
We are done.
Well done. It's been really great working with Ryan today. It's great to be part of this process of discovery as he learns to be a vet and hopefully to inspire him to continue to forge forward and to try things that he maybe wouldn't feel comfortable with before. Go on then, my beauty. Here we go. Oh, let's get you in a snuggly bed.
Morticia will spend the afternoon sleeping off her sedation and hopefully go home with owner Claire tomorrow.
Good girl. You're such a brave little thing, aren't you, eh?
At the Isleworth practice,
Good boy, come on.
Jane is bringing in Dylan, her rather chubby English Bull Terrier, and his housemate Delilah.
Hi, Jane.
Hello.
How are you?
Dylan and Delilah.
Hello, Dylan. Hello, mate. How are you? Hello, big boy. Jane, are we thinking that your Dylan's a little bit more of a handful than he normally is?
Yes, he's a little bit over.
You can't say no to that face, though, can you? I absolutely love when Dylan comes into the practice, and I absolutely love English Bull Terriers. Just maybe not so much of this particular one. Now, Jane, you know I had an English Bull Terrier, white English Bull Terrier,
Yes.
exactly like yours.
Yep.
So I have a good sense of how heavy they should be.
Should be.
So let's find out how heavy your boy
Okay.
actually is. Come on then, big boy. Up on there.
A healthy weight for a male English Bull Terrier Dylan size should be around 30 to 35 kilos.
When I get him on there, he's over 39 kilograms, which shows that he is clearly overweight, and this is a problem that we need to address. Come on, big boy, let's go. Come on, Jane, you've got to hear this as well. Come on. Being overweight is a serious issue. In the UK alone, about a third of dogs are thought to be either overweight or obese, and that can considerably reduce their lifespan. How much is he eating at home?
He just has a tub of yoghurt for breakfast. Only a small tub.
Right.
Of an evening, it's just his main biscuit meal.
And then, being that he is such a lovable, friendly, cuddly chap, does he kind of convince you that he should be getting more than that?
Yes, he's very...
Persuasive.
Oh, very much so, yeah.
Well, I mean, just looking at him physically, he is more like a brick than an hourglass. One thing you should be able to do is feel their ribs, and you can barely feel his, and that means he's just got a little bit too much padding.
A little bit too much fat.
A little bit chubby than you should be, hey, mate. But yeah, you know, obesity can be really dangerous for dogs.
Yeah.
They can get heart disease, they can have respiratory problems, they can have major joint issues, they can even get diabetes, or worst case scenario, even cancer. So this is a serious problem and we need to come up with a solution that's going to mean that Dylan loses weight.
I do love my dogs and I want what's best for them, so I'd like to get some weight off him if possible.
So I would definitely cut out dairy products 100%,
Okay.
and most dogs are actually lactose intolerant anyway.
He absolutely loves cheese, but we tend not to try.
I've got to
and
let
give
you
him-
answer your own question
Yeah,
on that
so
one.
no more cheese.
No more cheese, no. What about exercise then?
He's not one for playing very
Right.
much. You throw a ball, he'll look at you and say,
It's more
well,
of a
you
couch
threw
potato?
it, you go and get it.
The solution to pets being overweight is the same in people. It's because they're either eating too much or exercising too little. Crack out the Lycra, you know, headbands and leg warmers, and and then we'll have you come in for the grand weigh-in very soon.
Okay.
Yeah? Let's go and get those leg warmers on. Come on. Hey? Where's the Lycra? Where is it? Hey, there it is. Here we go. Good boy.
This looks super wild. Look at this.
At Scott's house in Surrey,
Nice and gentle puppies.
his wife Zoe and the kids are enjoying some playtime with 1-year-old Scully and the elder lady of the house, Betty.
So when Scott and I met, Betty was 8 months old and she was very much his little girl. And when I arrived, I was the other woman to Betty, and she used to look at me with total and utter disrespect. And if I said anything, she sort of looked at Scott a bit like, it's talking again. So I was definitely the other woman in the relationship. So along comes Scully, and she doesn't just enter our lives, she bowls in as this little ball of fluff. She's been an amazing addition to the family. It really has worked out better than we could have expected.
We're so happy that Scully was born.
The children love the dogs as much as we do.
And that adorable little face of yours.
And now something's got to happen that makes her from a little baby into a proper little girl. And I'm not looking forward to it. It's spay time. Poor baby. Are you into surgery?
As a former vet nurse, Zoe is understandably nervous.
A dog being spayed, it's the right thing to do. We're not going to breed from her, but it doesn't change the fact that she's got to go through surgery. It's going to be really hard, but it's got to be done. Baby, mummy's little fur baby.
Exercise for you today, boy.
Jane has brought 4-year-old Dylan and his housemate Delilah to the park to meet Scott.
Here's a good boy.
The aim is to get the overweight dog motivated to move more and hopefully lose some weight.
Dylan doesn't really know what's going to hit him. He's going to be put through his paces. He's not a great one for playing with a ball, so I think a little bit of extra exercise will be brilliant.
There's Dylan there.
Okay.
Scott has enlisted Ryan to help Jane with overweight Dylan's exercise programme.
This is Ryan.
Hello there.
He's my vet student, so that's your patient.
This is the big boy.
Yes.
He's been on his diet, like you said. Kept him to it. No treats.
Good girl.
Been very hard.
Today, Ryan is going to squire Dylan through his first exercise session. And first of all, we need to understand what motivates this dog.
So with us, we have these low-fat metabolic treats.
Wow. That's the reason you're in this mess. Hey? Oh my
Can't eat them
goodness.
all at once.
We know food motivates him. We need to see if there's any other treats or toys, anything else that will get this dog off the couch and run around the park.
What about this one, buddy? What about this one?
Oh.
Oh, that's a yes.
All right, well, let's get physical, as Olivia Newton-John said.
Before my time, Scott.
Oh, gosh. It's very important with Dylan that we start very slowly. He's an overweight and unfit dog, so we can't run a marathon straight away.
Come on, come on.
Start with short, sharp bouts of exercise where we get his heart rate up by using things like toys to get him motivated, get him running around, burning off the energy as he goes.
Good boy, Dylan. Good boy. Good boy. Dylan. Good boy. Oh, there we go. Oh, good boy. Let's have a look. Oh. So as you can see, his heart rate's up, so is mine. So all good signs. He's definitely getting the exercise that he needs now.
Hey, mate, you look like you enjoyed that.
I think he's a star pupil for today.
So look, exercise and diet, they're the keys, and healthy weight loss for a dog is about 1 to 2% of their body weight. Good boy. So about 400 grams a week would be fine, 1.6 kilograms a month, and very soon he should be able to, well, be beach ready.
Oh.
Oh, good girl. How you doing? You all right? Let's just see if you're going to use that leg. Hey. Clever girl. Clever girl. Yeah.
The next day, 4-year-old Morticia is recovering well from her knee operation.
Well done. Not bad for one day post-surgery. Hey, already using your foot. Good girl.
And that means the little dog can go home with her owner Claire and doggy sibling Gomez.
It's all right, baby. You haven't got to stay. We're just collecting your sister. She'll be here in a minute.
All right, let's go see Mummy, hey? Send you home. Good girl. Yeah, good girl. Hello.
Oh, my little girl dog.
Here's your girl.
Hello, baby.
Say hello, Mummy.
Hello, my little girl. Oh, little girl, look at me. Who's that? Little sister. Get a kiss, eh? Say hello, you. Oh, baby doggy. Oh, I'm so pleased to have Morticia back. She's only been away for just over a day, but I missed her lots.
So I'm really happy with the way the surgery went, and I think the proof is in the pudding in the fact she's already putting her foot down, which is wonderful.
Oh, well, at least it's all gone well. Good girl.
It has, it has. You were absolutely right in doing this right now because we've got ahead of the game. We haven't let arthritis set in before we fix the problem, so it's prevention better than cure. Morticia has been such a brave little dog. She's such a great little patient. But more importantly, she's a really important part of Claire and her family's life. So I'm just really glad that I've been able to pass her back to Mum in one piece. All right then, Sweet Pea. Good girl, be a good girl. If it's all right, I'll come and see you very soon once you're walking much better.
Oh,
yeah?
my little cherub, come on. Let's just go.
All right then.
So we'll take her home tonight, and I've got her little bed set out by the foot where I'll sit on the settee and she'll be on the floor next to me. So she'll be on her way to recovery. Good girl, Tishy, good girl. Going home.
Come on, puppy.
Later that day, Scott's wife Zoe and the family puppy Scully are arriving for their appointment.
My little baby is going into surgery for her spay. It's an anaesthetic, and it's kind of just sort of dawned on me today, really, what a big deal it is. It's a tough day. She's not silly, though. She knows. She's like, consult table? That can't be good.
Every dog feels the same way. Yeah. Obviously, it's a very serious operation today, and even though Scully is my dog, I still want to perform a full and complete physical exam on her.
All good?
All good.
Yes.
Lovely, yeah. She's a perfectly healthy and happy, and may I say, very beautiful puppy.
So I know this isn't a question that normally gets asked to the vet, but how are you feeling about today?
Yeah, I'm a little bit nervous. It's weird, isn't it? You know, it's a strange situation because it's like operating on one of your children. So, honey, here's a question for you. Do you want to be a part of the surgery, be in the anaesthetic and be in the surgery room?
Well, okay, I wasn't expecting you to ask me that.
Just before we were married, Zoe and I actually set up a practice in Portugal. And once the babies were born, we came back to the UK, and this is where our life has really flourished. So she has experience at being a vet nurse and understands all the pitfalls of anaesthetics and surgery. So I invite her to come into the surgery with me and to hold Scully by her little furry paw.
It's a hard one, isn't it? Because obviously I'm fine in surgery, as I have been in the past, you know, when I was nursing for you. But then for it to be our little girl. But then also I can't imagine sitting outside waiting. So yes, if that's okay, yeah, I'll come in.
Yeah, absolutely. Although you can't do that normal wifey thing where you sort of look and going, you missed a bit. You missed a spot. Yeah, you can't do that, okay?
All right, fine, but you are going to have to clear up after yourself. Don't expect me to do it.
I've got nurses for that.
Is that why you are the way you are at home? Interesting.
So the old team is back together again. Zoe and me as vet and nurse. We're much better at husband and wife, however.
Let's go.
Come on, Fluffball. Let's go. Come on. Let's go with Nurse Mummy. Hey, Jess, the Millers are here.
Hi, Scully.
So our little baby is in for her spay today.
At the Richmond Clinic, vet nurse Jess will be assisting Scott and Zoe with Scully's operation.
Brave Jess facing not only her boss, but also the boss's wife and their dog. I mean, it's bad enough when you have to deal with your boss, but boss's wife, watch yourself. Brave girl, sweet girl, brave girl.
Scott has been a part of Scully's life from the moment she was born.
And what you're going to do is you're going to rub it really firmly on the chest.
Scott delivered her by caesarean section 12 months ago.
Ems, how's it going out there?
And she was later given to him by the grateful owner.
4, 5, 6, breathing puppy!
Hey, good job, well done. Quite nostalgic moments like this where, for Scully, she was born in my hands on the very table that I do for spay. Mummy and Daddy love you very much. So to have her life in my hands one more time is really special.
Sleepy.
Here we go, here we go. Okay, so just gonna clip that lovely puppy tummy of hers, okay?
Lovely tummy.
We'll just move her through.
Yeah, no worries. I'll go grab a scrub top.
Yeah.
Stay out your way.
That's right. Okay. Come on, baby.
Love you, baby. How do you put into words how you feel in that moment? I'm both a mother of children and a mother to my little puppy as well, and it's time to go into surgery.
Okay. All right.
Good.
Jess, I'm just about to cut. Everyone happy? Well,
Well, yeah.
no.
Happy might be an overstatement.
Yeah. I've at least done 1,000 dog spays, I would say, over my 20-year career. But of course, it's very different when you are operating on your own dog. But for Zoe, she's very nervous. And even though she's confident in my abilities, anaesthetics are risky, and she knows that. There we go. So that's it.
That's the uterus?
Yeah. So there you go. And there's the ovary there.
Oh, wow. It's so much smaller than you imagine.
So, I mean, at moments of that surgery, I did feel a sense of nerves.
You're shaking.
Well, I can feel myself shaking, but then I'm not shaking, so I think it's just in my mind.
Okay. I wouldn't blame you, in fact.
I think what today's taught me is that each animal's special, and the 1,001th spay is just as important as the first. And we can close up.
Very neat.
I aim to please. Got a very exacting client that's going to be looking at this with eagle eyes.
This is true. So impressed, though. I think I'll get you to do the kids' name labels on their school uniforms from now on.
I think we both know that's not going to happen. All right, let's wake our girl up. Thankfully, this spay went completely without a hitch. There was no complications whatsoever. So it meant that the stress for Zoe and I was over quite quickly and that Scully could wake up. Here we go. Hello. You know, it is extraordinary to think she popped out into life on this very table.
It's mad, isn't it?
Scully will stay at the clinic for a little longer before going home later today.
All done.
Let this be the last time you come in to see Daddy at work.
OK, you two, time for lunch. Nicely. Good boy.
It's been 8 weeks since Dylan was put on a diet. His owner Jane has now replaced his treats with healthy fresh fruit and vegetables.
Good boy. Come on. Good boy. Come on.
And today there's time for one last jog in the park before Dylan's big weigh-in at the clinic.
I think he quite enjoys all the exercise and the running that will help to bring his heart rate up and to get him a bit more active and to help him to lose the weight. Getting a bit puffed, but I'm enjoying it. Yeah, so hopefully I'll lose some weight myself. See how much you've lost? Hopefully you've lost a nice bit of weight.
Hello! Hello, handsome boy. Dylan.
Hello.
Hello, mate. How are you?
He's gone straight to Dr. Scott.
I love my boy. Well, he knows who to keep sweet, doesn't he? Seeing Dylan walk into the practice, he is sprightly and he's happy, but more importantly, he looks lean and mean and ready for the scales. So he was 39 kilograms before. Oh, wow. 35.4, that is absolutely incredible.
Really good.
Well done.
Thank you.
That's amazing. So he's lost 4 kilograms, which basically is about 10% of his body weight. So it's like if I lost about 10 kilograms, you definitely see it, and we definitely see it with your boy.
Yeah.
Well done. By Dylan losing all this weight, it means he's far less likely to develop issues with his heart. He's far less likely to develop arthritis as a result of all that extra weight, less likely of developing diabetes. He's generally going to be a very healthy and happy boy moving forward. So he's still got a little bit of a tum, but what you can feel and see here, look at those, they're ribs. Yeah, well done, Jane. You've done so well. Brilliant. Good job.
I'm really, really pleased that I've managed to keep him to his diet and not give him any extras. It's been hard, but I've done it and I've spoiled him in a different way. Carrots and love.
No more cake for you, Dylan.
Scully! Scully, pop up!
In the Miller home, Scully is well and truly recovered from her space surgery, much to the relief of Scott's wife, Zoe.
No one chooses to put their animal through surgery or through anaesthetic, but this was an important decision, and it was the right decision to get her spayed.
Yeah.
Wow. This is a bit of a treat, isn't it? What do you want?
I cuddle with my puppy, my loving wife.
Oh, there you go. Then, well, then you got it. You got it. Teal by you, that.
Bozo and I were committed to neutering our dogs as we've always been. It's really important. There's so many unwanted and homeless dogs here in the UK and throughout the world, and neutering is the one way we can try and control those numbers.
Oh, puppy.
What do you think?
Should I jump up if I could?
What do you think of that puppy?
When Scully came back, she was a bit blue, and Betty was so lovely because she just gave her that TLC and care that Scully always shows Betty because she's so careful with her. But I do think she's much happier now. She's up and bouncing around, and the two of them can do their rough and tumbling again.
Oh, this is a very beautiful family scene, isn't it? Hi, Claire. How are you?
Hi, Scott.
And Scott is meeting Claire and her daughters to check on Morticia's progress after the Boston Terrier's knee operation.
Let me get my hands on that little patient. Hello, Tishy.
Hello, buddy.
Hello, baby. You simply cannot push that kneecap out anymore. She's not painful at all. She's just sitting here comfortable. That's very, very good. I'm so happy with that. So I think the proof really is in the pudding with you, isn't it, Mrs.? We need to see you running around, and hopefully that mischievous little skip of hers is going away for good. So how can we get her to run?
Ball.
Ball?
Ball.
She's just moving beautifully well, isn't she? Nice and strong on both legs. No evidence of the skipping at all, Cleo. I can't see it anyway.
It's good, is it?
Yeah. Ready? Morticia is running so beautifully, moving so well. There doesn't seem to be any pain, no discomfort, and that knee looks absolutely perfect, so I'm very happy. I think her knees are perfect, but I think that fetch is rubbish. That is awful. Okay?
Morticia's off to the races again now. I can let her off the lead, she can run around and have a great time. And she's going to have years and years of no arthritis. Great.
You've been brave and you've invested in the future of her knee health, which is great. And now all you need to invest in is maybe a little bit of dog training. I think we need to work on a fetch.
You like quail's eggs, don't you? You could do with some of those nice quail's eggs now, couldn't you? Yes, you poor little thing.
In Richmond, it's an anxious day for one of Scott's long-term clients, drama teacher Julia.
Such a good girl, aren't you? Yes, you are. My last pug was called Oscar, and I always wanted him to have a wife, and I thought I'd have to call her BAFTA, so I'd have Oscar and BAFTA. But alas, he died before I got BAFTA, but I still called her BAFTA. So that's how she got the name. Another close-up, Mr. DeMille.
Recently, Julia became alarmed when she discovered a lump growing under BAFTA's eye.
Getting sleepy again, aren't you?
A biopsy confirmed that it's cancerous.
Which was a horrible blow to me, because I always hear that word, you just think, oh no. I don't think it's nothing. I'm just hoping that it turns out to be nothing. That's what I'm hoping. What can one do but hope? There's a good girl.
Today, the little pug is booked in with Scott for surgery to have the whole lump removed.
BAFTA, are you all right, Danny?
It will be sent away for further testing to determine the type of cancer and whether it has spread.
Good morning, Julia.
Hello, Scott.
Hello,
Yes, she
gorgeous.
is. How lovely to see you.
And
How are
you?
you?
Oh, I'm grand, thank you very much. And how's our girl?
Are you going to look after my little pug for me?
Well, of course.
Thank
I
you.
dare not do anything else.
No, thank you. I know she's in safe hands.
Come on, gorgeous. Do you want to come in Uncle Scotty's safe hands? Yes?
Good girl.
Julia is an incredible lady. She's so much fun. She's so vibrant. She's so full of life. And BAFTA's a great little dog. She's so characterful. She's strong and she's brave. She's pretty much Julia in dog form. Well, first things first, Julia, tremendous matching outfits.
Well, we have to look our best, don't we, Beth?
And it makes the girl feel special as she's
Yes.
coming in for surgery today. So let me have a little feel of this little lump. So, yeah, it feels literally like a pinhead. Julia's brought BAFTA back into the practice today because just recently we've diagnosed a mast cell tumour underneath her left eye. So mast cells can be devastating and they can cause lots of issues throughout the body, not just in the skin area that you find them.
Yeah, I've got you.
And sadly for BAFTA, she's a bit of a cliche when it comes to mast cell tumours because pugs are very prone to them.
Oh, poor little Beth.
So it's very good that we've found this very tiny lump early because it does mean that we can remove it and then find out exactly what grade the type of tumour is, and that really gives us a good idea as to how dangerous or not it is to little BAFTA.
I've got you.
The range of possibilities today are either fairly benign, we can remove it really quickly and easily, and it shouldn't spread, or it could be a very nasty type, which means that it may have already spread to other parts of BAFTA's body, and it could mean that BAFTA isn't around for very long. You and I have been friends for a while, so
Yes,
I know
Scott,
and I can see that you're worried.
Well, of course I am, but I know if anybody can sort her out, you will. I'm terrified, to be honest, because madding though she is, I adore her. I shall be relieved if we hear that nothing awful has happened, but I shall worry, of course I will. Yeah, it's just got to hope. Be good for Scott. Yes, good girl.
Hi, Tina.
Hi, Lily. What do you have there?
This is a little stray that's just been handed in at reception.
Oh, hello, beautiful.
She's gorgeous.
At the Isleworth practice, Nurse Lily has a new patient for vet Tina.
She was found by a member of the public.
Okay.
Who was a bit worried about her, but she feels a little bit skinny, so she's brought her into us.
All right. Should we just check you over, honey buns?
She brought her in and said if we didn't find an owner, she'd like to adopt her, but she thought she should do the right thing and double check first.
Let's see if you belong to anybody, miss. Okay.
Hopefully she does.
The first step is to see if the stray kitten has a microchip.
You just got to remember when you check, they can migrate under the skin. So you always check the whole body from head to tail, including the legs. So unfortunately, there's no chip there.
Oh, sorry, miss.
There's no owner, I'm afraid.
Oh.
Okay. It gets a little bit difficult when there's no microchip because there's no way to trace where the animals come from. It puts the importance to remind owners that cats do need to be microchipped. They wander around and they can easily get lost, as in this case.
She's been scratching quite a lot. I think she might have some fleas.
Oh, there's a flea.
I think we found the cause of the scratching then.
But Tina has another more serious concern with the little stray. Depending on eye colour, up to 80% of white cats can be born with congenital deafness.
So what I want you to do is I want you to try face her and keep her on you. And then I'm going to make a noise over here, quite a loud one, to see if she can hear it, okay? All right. So just get her attention that way. She's reacting, not as much as I'd expect her to. I'd expect a cat to
turn round. Yeah.
Okay. So she's reacting a little bit to the noise. So probably there could be a little bit of a hearing impairment there. So that's something we just need to keep in mind.
Yeah.
If we can't find the owner, then we might need to look at rehoming to mention to the prospective new owner. I'm not too worried about her quality of life. I examined the ears with the otoscope and they're healthy inside. So it's possibly something she was born with. And if she has a little bit of hearing, she will adapt all her other senses and manage and have a good quality of life with the right owners.
You're going to stay with us for a week?
Yeah, I think that's a good idea. Hey, we can fatten her up a little bit.
Yeah, she's probably very hungry.
Definitely.
Legally, we have to keep her here for 7 days and advertise her to see whether we do find an owner. Hey, sweetie, should we get rid of those nasty fleas before we give you some dinner? How does that sound? Yeah? So we'll just have to watch and see whether anyone comes forward. But either way, whether we find her old owner or the lady takes her home, she's got somewhere to live for the rest of her life. You're looking for food, miss, aren't you? Should we go give you some dinner?
Oh, that's a funny noise, isn't it? Hey, Reagan.
Hiya.
This is BAFTA.
Hi, BAFTA. Hello, cutie.
Oh, wow, she likes
you. Hello.
In Richmond, Scott is about to perform surgery on little pug BAFTA.
She's a girl's girl, I think.
Vet nurse Reagan will be assisting.
So what is it we're doing with her today, with her eye?
Well, yes, it's a tiny, tiny little lump. You'll barely be able to see it just in the skin fold here.
Okay.
And unfortunately, we took a little sample because we're a bit worried about it. We sent it off to the lab and they've said that it's a mast cell tumour.
Okay.
All right, should we give you an anaesthetic and get that nasty lump off? What do you think? Still wagging your tail, so that's a good sign.
Today with BAFTA is all about just getting rid of this lump. We want to take quite a wide margin and remove it completely to allow the pathologist to have a look, not only to grade the tumour, to tell me should I be concerned about the possibility of its spread, but also has it spread locally within the skin itself.
All right, sleepy time now. Brave girl.
Good
Here
girl.
we go. Oh, good girl. All right.
Oh.
Suddenly, there's a problem. BAFTA has stopped breathing.
Come on.
Come on, BAFTA.
Come on.
Come on, BAFTA.
At the Richmond clinic, BAFTA the pug is about to undergo surgery to remove a cancerous lump. But suddenly, she stopped breathing.
Pugs always present quite a challenge when you anaesthetise them because their nostrils generally quite small, but also in the back of the throat there's an elongated soft palate that floats over the windpipe. And it means that when you knock them out under anaesthetic, they can't really breathe very well. Come on. More breath there.
Was that what, did you say you just saw one?
Yeah, there's another one. A few little breaths there. Did you see that? Yeah. There you go, BAFTA. That's what we like to call in the veterinary profession breathing. You know? It's not too much to ask for, is it really?
No, it's not, but it is what we want to see, so.
BAFTA did something that a lot of dogs do, which is breath holding. So when you give the anaesthetic, they don't breathe for a little while until the carbon dioxide levels build up to the point where it encourages the animal to breathe. But in the case of a pug, you have got all of these abnormalities to their respiratory tract anyway, so the last thing you need is a pug that holds their breath. All right, so we can see the lump a little bit better now. So there it is there. Interestingly, as soon as we clipped the eye, that lump really did get quite angry indeed. It seemed to be mad that we'd exposed it. Now it had gone from kind of a pinprick-sized lump to quite a decent-sized red mass. So now more than ever, I'm very keen to get rid of it. Okay, let's go. Good girl. Come on then. Okay. Good girl. That's it. Right, here we go. Okay, so just about to start cutting. All okay? Yeah. There'll be quite a decent amount of tissue I have to pull away here. We're dealing with really quite small margins here. I can't move too much because it's in a really important area around the eye. So if I cause too much tension, then it might affect the way the eye can close and obviously how BAFTA looks. So it's a balancing act. There we go. All right, so that's that little tumour out of BAFTA's body. Now I'm sending off the mass to the lab and we have an agonising wait over the next few days until that result comes back. I'm really hoping that the tumour that I've removed is a low-grade type of tumour, and by removing it simply, that's the end of the problem. But it could be that it's something quite malignant and can have already spread through BAFTA's organs and really be a major issue in her future. There you go, sweetheart. There we go. All right.
She is a really cute pug.
Right there. Is that right? Hopefully that's pug for thank you.
I think so.
BAFTA will sleep off the anaesthetic and be ready for collection later in the day.
Hopefully that's that, eh?
Hello, Maz.
Hello, Julia.
I've come to fetch my little BAFTA. How is she?
She's good.
3 hours later, Julia has arrived, anxious to see her precious little pug.
So where is she?
Right, if you grab a seat, I will let Scott know you're here.
Thank you. I will grab a seat. Bye-bye, boy. You're very gorgeous. Yes, you are. I didn't really sleep last night because I was worried about her. I just want her home with me to know that she's all right.
Hello, Mummy.
Hello,
There she
Baffy.
is.
Hello, my little Baff. Oh, what's she got her little tongue like that for? Oh, she's a bit dopey, isn't she?
She's nice and sleepy, which is quite useful, isn't it, to be able to examine this eye. But you can see, hopefully, there, I've removed
Oh,
that
yes.
lump there.
Yes. Oh,
A
yes.
little bit of plastic surgery to boot to
Well,
make it
thank you for doing
beautiful.
that. That's
But of
brilliant.
course, now we have our
We have to wait for the
anxious
results.
wait to get the lab to do what they need to do in order to determine how worried we should be with regards to this tumour. Although I'm really happy to have the cancer removed from BAFTA's face, I'm obviously very concerned about whether it's spread or not. I'm really hopeful that it hasn't. I've done everything I can to try and rid BAFTA's little body of cancer, But all we can do is cross our fingers and pause and hope for the best.
I think you'll deserve a BAFTA after today.
I think you deserve a BAFTA.
I think you do too, sir.
Well, thank you very
We all
much.
do.
Let's give ourselves awards, shall we?
Let's have a BAFTA party, yeah, especially if everything's all right.
Yes.
Definitely.
Okay. All right.
Definitely.
Well, I'm going to bring the champagne for when I see you next.
And quail's eggs for her, because she loves quail's eggs.
Quail's eggs?
Absolutely. Absolutely.
At Scott's Richmond clinic, new patient Shearer has arrived with his owner.
Come on, good boy. Hi, Sam. Hello. How are you? I'm all right. How are you doing?
Bethany and her 13-year-old collie are good friends with Nurse Sam.
You're very nervous, aren't you? Don't like coming to see vets.
No, he doesn't like it. He's not a happy boy. Poor little lad. So Shearer is a lovely boy, but he is a collie. So collies have some quite specific breed traits where they can be a little bit suspicious.
Oh, he's really scared.
Which has made it very difficult when we come to the vets because he gets very nervous. And as soon as things get a bit serious, that's when he starts to get a little bit snappy. Come on,
You're going to be all right.
Come on. This way.
He's not so sure.
No. Bless him.
The 13-year-old collie is extremely anxious around vets, so it's been a long time between checkups. Bethany is hoping Scott will be able to win over the nervous old dog.
Hello, Bethany. How are you?
I'm all right, thank you.
Oh, that's good. I've heard lots about you, but possibly a little bit more about your chap.
Oh, yeah, he's all right.
Well, we'll do the pleasantries in the consult room, shall we?
Cool.
Come on through.
Shearer, this way. I know that Scott would be sensitive to Shearer's anxiety, and he won't mind potentially getting bitten.
This is what he does most. He just kind of hangs out at the door. You can smell freedom, can't you?
Is that the escape route, my boy?
Yeah. He's not a massive fan of the vets. Don't take it personally.
Okay. Sam's given me some history on Shearer, and he has just had some unfortunate incidents at vet practices. So hopefully a new environment, a new vet, he might be a different dog. Fingers crossed. Now I'm just gonna do my usual thing of not really looking at him in the eye because that's always a bit threatening.
Yeah.
And just sort of be quite dismissive and submissive and just see what he does. Hello.
He's just one of them collies where the signs are very subtle. It'll be his ears go back and his eyes go wide, and then that's him saying.
And it can just be just a like, I'm fine, not fine.
He doesn't give much warning. He won't growl. He will just snap.
Okay, my heart rate's rising just having this conversation. So beyond his little snapping issue, what else is concerning you?
So he's got a lot of lumps and bumps all over his body, but then there's one hard lump that's come up on his shoulder blade that I'm a little concerned about. Check his teeth. He's also not microchipped.
He's not
Or
microchipped.
vaccinated.
Right. Well, we definitely need to microchip him.
Yeah.
Now the law is in, we need to make sure that's done, and vaccinations are always important. So, wow.
Full service, please.
Yeah. So what's probably best is that we go downstairs together, you pop the muzzle on, then you say your goodbyes, and then we get going.
Okay.
Yeah?
Brilliant.
Come on then. Come on then, mate. Good boy. Yeah, always very keen for that door, isn't he?
Yeah, bless him.
Escape. Hooray!
There's another one.
So far, Shearer has been beautifully behaved, but you can tell that he's quite nervous and that makes him unpredictable. So sadly, we still need to muzzle him in order to put him under anaesthetic and fully assess Bethany's long list of concerns. All right.
Not big follow.
It's like leaving your baby.
Auntie Sam will look after you.
Knowing that they want someone that they know around them, and there's just lots of unknown people and they're sticking needles in him.
All right, Bethany.
Okay.
See you later.
See ya.
Bye. I know.
It's really tough, and just hoping that everything will be all right.
We're not all bad. No. In order to get Shearer anaesthetised, we first need to sedate him, but he's a nervous boy and so not going to take this lying down. So we need to use a technique similar to the one we use in larger animals, the door technique. I know, Matt, I think you have an awareness of what we're about to do, don't you? We feed the lead through the gap in the door so we can squeeze him with the door and the wall, and it produces a race, which is what we use in horses, for example, to keep them still and protect the people that are working with them. Okay, Nathan, you ready? Let's just hope that this nice, genial chap will take it well. Good boy.
All right. Good
Okay.
boy. Good boy.
Good boy. If you just move him towards the door.
At Richmond,
Okay, Nathan,
Scott
ready?
and his
Just
team
move
are
that
trying
a
to
little bit there.
sedate nervous collie
Good
Shira.
Good
Good
boy.
boy.
It's all right. Good
Okay.
boy. Good boy.
Good boy.
Good boy.
Good boy.
Sure, it's all right.
Nathan, you
It's all
got
right.
it. Well done.
Good boy.
Well done, mate. You got it.
Yeah. Good boy. Good boy. Good boy. Oh dear, horrible people. Okay, yeah, we'll let him back out again. Oh, what awful people we are, hey? Oh dear. Oh dear, that door. Hey, I blame the door, don't you? See, look, he likes me because he thinks you're horrible. Shira's not a bad boy. He's simply afraid. But a fearful dog is an unpredictable dog, and so sadly, we just can't take any chances. Phase 2.
Ready?
No one's there. We're ready. Oh, he's a good boy. That's it. That's a great shot, Sam. Well done. Once the sedation starts to kick in, we place a second muzzle over Shira's eyes, which helps to keep him calm, and that allows us to place the catheter and finally get him anaesthetised. Can you just come and turn the anaesthetic on for me, Sam?
Okay, so.
Good boy. Big, deep, calm breaths. It's all right. Okay, good boy. Now that Shira is finally under, we have to work quickly, and that's why I've got both Sam and Nathan helping me today. Bethany's given us a really long list of concerns to get through, and at 13 years old, Shira's an old boy, so we don't want to keep him under any longer than we have to. Now, let's have a little feel of where that lump was. If we all just have a good feel of him just from head to toe and feel anything that you're concerned about. Ah, there it is. Can you pass me those clippers in front of you, Nathan, please? Yeah, having a little feel of this, it's a clearly defined lump within the skin itself. It feels a little bit fluid-filled. So I think that this might just be a dermoid cyst, so something that's a benign growth in the skin. I'm just going to pop a needle in it real quick. I'll just have a look under a microscope. Okay, everything I can see here is just normal tissue. So I think in this case, Shira's an old boy. He's developed normal lumps and bumps that older animals do, but it's certainly nothing to worry about, so we don't need to remove it.
But Sam's found something that does need to be removed.
There's not a lump, but there is a big tick. It's quite juicy.
Massive. Ooh. Oh, nasty blighter. Okay, well, not bad news because we can just take that off. So let's remove that tick, please, Sam. Yep. Good news keeps on coming. Ticks are nasty little creatures that suck blood, but they can also carry some really nasty diseases. In the UK, they can spread something called Lyme's disease, which people can also get. In the larger European continent, they can spread tick fever, and in Australia, they're known to cause paralysis.
Wow.
It's horrible.
Massive.
It is massive.
Oh, he's a big boy and he's still moving. Means you've got the head out, so well done, Sam. The best way to prevent ticks is by using either a topical liquid applied in between the shoulder blades of your dog, or there are some oral medications that you can use as well. These things either kill the tick before it can bite, or if it does bite, it kills it before it can transmit those nasty diseases.
Scott now wants to check on the condition of the 13-year-old's teeth.
You know, really very good teeth for a dog of his age, and I feel like I've gone boldly when no one has gone before, which is inside the mouth of the savage beast. He's not really, he's a pussycat. Vaccinations are very important, but it's a shame with Shira that this first has to be done under anaesthetic. All right, so last but not least, we'll just do the microchip and then we can wake this boy up. Great.
It's all legal now.
He is, he's all legal. Hey, good boy. All right, that's it. All right, let's wake this boy up. I think we're good friends now. We. I say to him whilst he's fast asleep.
Yeah.
It's not very often that you get a dog as old as Shira come in with as many concerns as he had, and yet get to send him home with a clean bill of health. Good boy. Now, sleepy times for the old man, eh? Hopefully, we've shown him that there's really nothing too much to worry about. I'm even hoping that I might have made a new friend.
Good boy. You have a snooze, I'll call Mummy. Good lad.
What's this?
At the Isleworth practice, Nurse Lily has her hands full, looking after the little stray that was handed in 3 days ago.
You really were hungry, weren't you? So legally, we have to keep her here for 7 days and advertise her to see whether we do find an owner. We have to give them that opportunity to come forward and say, this is my cat.
Can't get any work done when you're about, can you?
Nope. Yeah, so we checked for a microchip, but we couldn't find one, unfortunately. So if she does have an owner out there, we can't track her down.
I can't believe no one's come forward for her. I know, she's just so cute. I know. Look at that face.
The playful kitten is lapping up the attention from Nurse Lily and Aussie receptionist Liz.
You're adorable, aren't you?
Yes, you are. Oh, bless her.
So funny.
Yeah, so we'll just have to watch and see whether anyone comes forward. If not, though, I think we might have an owner in the lady who brought her in, but she seems very keen to take her home.
Hello, champ. It's time to go home now. Hey?
Back at Richmond, Scott's patient Shira is ready to go home.
Take that off because I trust you. Yes, I do. There we go. Oh, he's a good boy. See? There we go. Should we go home and see Mummy? Yeah, come on then.
Upstairs, Shira's owner Bethany can't wait to be reunited with her boy.
I thought I was going to be all right, and then as soon as I left him, I started fearing the worst. It was horrible. I didn't want to leave him.
Where's Mummy? Where's Mummy? Go get her.
Shira!
There she
Puppy!
is. Look, who's this?
Puppy! I'm so sorry. Oh, he's a good boy. Are you sleepy? Oh, you got me. Oh, how are you doing? Oh, puppy.
So, I'm very glad to see you guys together, and he has been such an angel. He's been a joy, really, haven't you, mate? You've been a good boy.
Joy.
But the good news is even better, because not only has he been a gentleman, but all the concerns that you had, they're not concerns.
Oh, that's brilliant.
So the lump here is just a normal old cyst that's present in his skin.
Okay.
And that's absolutely fine. No need to remove it. Yes, he's an old boy. He's got a few old dog problems, but that's all they are.
That's good. Well, at least we've come and got him, got him all checked out.
over. But yeah, symptoms of old age, but not of disease.
Oh, yay, good boy. I'm so happy that he's got basically a clean bill of health.
Now I hope that you'll come and do some social visits. It'd be nice to see him and not have to do anything mean to him.
Absolutely.
Hey, buddy.
And Scott was absolutely brilliant with him. And now we can go home for dinner. Say thank you, Scott.
Bye, champ. Take
Thank
care.
you so much.
See you later. Nice to meet you.
Bye, you too.
Bye.
Good boy. Come on, puppy.
It's a new day, and in Richmond, it's an early start for Scott.
Hello.
Hello.
What you doing?
I am packing up for a trip up north.
What are you going up north for?
Well, there's this amazing donkey sanctuary that's run by this incredible family of women who love donkeys. Jenny, the youngest girl, she has set this place up. Absolutely inspirational girl, but at the same time, they've been through a lot of tragedy.
Really?
Oh, they all attended the Ariana Grande concert. And Jenny's two aunts were caught up in the blast. They were quite badly injured. And they really struggled to keep the sanctuary going. And it's only with the help of volunteers they've been able to do that. So that's why I'm putting my hand up to go and help. Like everyone watching, I was horrified by the Manchester bombings. You feel so useless, as there's nothing that you can do to help. But today's different. I'm on my way to visit a family of survivors, and hopefully I'll be able to help by offering treatment to the animals they love.
Scott is heading 4 hours north to West Yorkshire and the Wonky Donkey Sanctuary. "19-year-old Jenny is the founder and is running the sanctuary with her mum and 2 aunts. They're currently caring for 19 rescue donkeys.
When donkeys do arrive here, they are in a very poor condition. You get a lot of time donkeys that don't really know where to place themselves, feel very uncomfortable. They do come in as a shell of a donkey, and then they end up being a very unique little character.
Hello, ladies.
Good morning.
Hi, how are you? I'm Scott.
I'm Jackie.
Hi, Jackie.
Hi, I'm Jo. Thanks for coming.
Oh, you're very welcome.
I'm Josie.
Hello, Josie. Nice to meet you. There's a thing going on here.
I'm Jenny. Nice to meet you.
Hi, Jenny. Nice to meet you as well. What a perfect family to be running a donkey sanctuary where males are called Jacks and females are called Jennies.
Yeah, absolutely.
It was meant to be, wasn't it?
Yeah.
I'm very excited to get stuck in and help you look after your lovely animals. So I'm going to chuck my overalls on, and then maybe you can introduce me to my first patient.
Yeah, baby donkey first. So
Baby
she's a
donkey
lot of
first.
fun.
All right. Looking forward to it. You guys look like trouble.
So here she is.
Oh, she's gorgeous.
She looks gorgeous, but she's very, very naughty.
Oh, is that right? Are you naughty?
Come here, Rosie.
Rosie. Hello, beautiful. Hello. Oh, my goodness. You're so cute.
Rosie is the most adorable donkey that we've got, but mainly because she's the baby donkey. Having her as a baby has just been the most amazing experience, just to be able to hand rear her, really.
Oh, she's so nice. So what does she need doing today?
So today it's microchipping and vaccinations for Rosie.
Dear. I'll hug her now because she won't want to hug me later if I have to do all that stuff. All right. Oh, baby. Hey? Mwah. Ready?
Good girl.
Sorry to do that to you, sweetie. There you go. Performing a microchipping on a donkey isn't very nice. It is a little bit like harpooning a small horse. So just going to pop in a little bit of local anaesthetic under the skin just to make it as pain-free as possible. There we go. Good girl.
Come on then, Rosie.
Around this way. Brave girl. Brave girl. That's it.
Oh, Rosie, look.
Okay, you ready? Okay, brave girl. There we go. Okay. It's in. She's very good. Oh, brave girl. Well done. Good girl. Well, the carrot worked.
Yeah, it did.
Good girl. All right, let's just scan her and make sure that that's working okay. There we go. Your donkey officially beeps. Good girl, Rosie. Well done. Now we just got to give her a vaccination. Okay, just going in there, and that's it. Done. Oh, good girl. She's been an incredibly amicable and easygoing patient, which is great for me. Not that much donkey experience. You're so lovely, but naughty. I can tell you're naughty. Hey, she's like a toddler, isn't she?
She is a very naughty toddler. We've entered terrible twos, I'm afraid, already.
Yes. Did you hear that? Yeah, yeah.
At the Wonky Donkey Sanctuary in West Yorkshire, Scott's next patient is Olaf the goat.
A goat at a donkey sanctuary?
Yes. He's still very new, but he is very sweet, so hopefully he won't mind you visiting him.
Jenny's Aunt Josie is still recovering after her leg was badly injured in the Manchester bombing.
Come on, good boy.
And she feels a special connection with Olaf.
I think it's when you see that something can be so frightened and confused and they don't understand, which is very similar to being in a traumatic event. You can just go and have a little touch and you see them improve and gain confidence. It's so rewarding. I think it gives you that good feeling, and that's what helps you to heal, you know.
Well, there's a lovely old goat.
Which one?
How did a goat manage to find his way to a donkey sanctuary, Josie?
Well, we got contacted by the police at 3 in the morning to say that they'd found a donkey on the motorway. Would we take it in? So, of course, we said yes. And then this arrived. So he said that it's not actually a donkey, it's a goat. We said, oh, right, well, we'll take it anyway. So we took him in, very timid. He's a really sweet little man.
He's very sweet.
We don't know anything about him, of course, and no one's claimed him, so it looks like he's going to be staying. We don't know if he's been hit by a car at all. He just spent 3 days in a corner, wouldn't come near you. Jenny went in, spent quite a bit of time with him, and progressively started to eat and drink. Donkeys are fascinated by him.
Yeah, I bet they are. Again, that's the weirdest looking donkey I've ever seen. All right, so what do I need to do with this guy?
Well, he needs vaccinating, worming, and hoof trimming.
Right, God, you're a taskmaster, you are. Yeah. Have a little look at your hooves, can I, my man? Hey?
It's the left front one that seems to be twisted.
You can see it's actually flared out a little bit, isn't it? That toe is just a little bit overgrown. Okay. He's probably been on soft ground for quite a while, and as a result, they're overgrowing and it's leading to him rolling in on his hooves. So you can see the insides of both of his cloven hooves there are just a little bit wide, so we just need to trim away a little bit of that. Just taking that extra bit off there. All right, sweetheart, there we go. I haven't done a goat manicure in a while, I must admit. Good boy, you're being a very brave boy. Not as brave as your mum and your great aunts, but, you know, he's been pretty good. Because you've had a few problems with your leg as well, haven't you?
It was a bit of an ordeal.
I can imagine. And he's complaining about a hoof trim.
I know.
Honestly, I'd be keeping quiet if I was you, young man. Gee whiz. Josie's an incredible woman and so brave after what she's been through as a result of the Manchester bombings. But now she's back working here at the sanctuary doing what she loves, which is looking after these beautiful creatures. Milkshake for goats, hey?
Scott did really, really well. He was patient, kind, firm, and got the job done.
Well, he was a pretty good patient, what do you think?
He was very good, yeah.
All right.
He's come a long way in a short time.
He has, yeah.
In Isleworth, it's now been 7 days since a stray kitten was handed in, and it's an exciting day for her rescuer, Georgia.
Hello. You come to pick up your little white cat?
I have.
Has she got a name yet?
Yeah, I've called her Alba, actually.
Bless, what does it mean?
No owner has
Means
come
white and
forward to
Latin.
claim the little
like
kitten,
that.
so a delighted Georgia has come to adopt her.
Do you want me to go get her for you?
I really love that, yes, please.
No worries.
Thank you. I fell in love with her the moment I met her, so I couldn't really resist buying her toys and cat litter and the trays in the hope, that she would be mine. And I've never had pets before, so I'm just really glad that I can have her.
You ready to meet your new mum? I think that's a yes. Here she is. Oh, hey. Oh, hello, Alba. Hello. I think she recognises you.
I think she does. Hello, baby. It's so nice to see the reaction of both of them, and I'm sure Alba will have a fantastic time at a new home. She was just so hungry and skinny when I met her. I found her in the street and she looked really hungry, so I brought her into the nearest vets that I could find. I could have taken her home there and then, to be honest with you.
You happy to have her in your arms?
Oh, I'm so happy. I've had to wait a week, haven't I?
I know. We're all going to be sorry to see her go here. She's so sweet.
It's a lovely thought, really, that Alba possibly chose me as her owner, because when I first met her and she was really purring and really affectionate, and she cried when I left her at the vet's the first day I brought her here. So, to be honest, it's a relief that I can take her home today.
Here's your transport to your new home.
Let's get you home, darling.
Here we go.
Yes.
It's been amazing to have Alba here all week. We're really going to miss her, but she's definitely going to a great home with Georgia. And although it is sad to see her go, I'm so pleased she's found a home.
Thank you so much.
No worries.
I can't thank you guys enough. I'm so glad I brought her in.
No worries.
Thank you.
Bye.
Bye.
Oh, we'll get you home.
Oh my my goodness.
At the Wonky Donkey Sanctuary in West Yorkshire, Scott has one last job.
Where have you been hiding these little kitties, Joanne?
Scott's been asked to look at new mum Coco, trying to care for 5 hungry pups.
She looks like she's seen some better days, though.
Yeah, she's not doing too well regarding her weight and her skin.
Mm.
Coco is a lovely Rottweiler girl. She's about 2.5 to 3 years old. She arrived here from her old owners and they couldn't look after her anymore owing to family health.
I'd say we'd have to think it's probably some kind of mange, and I would suggest it's probably sarcoptic mange.
Yeah.
So I would like to officially announce that the milk bar is now closed.
Woohoo, Coco.
I don't think that this little lady needs to give up any more of her hard-earned nutrition on these puppies. She's done a great job. It's very clear that Coco is very thin, and as a result, her immune system is going to be quite weak, which is probably why she's developed the mange in the first place. The puppies need to be weaned, and so Mum can start putting on some weight and getting healthy again. So we're just going to apply a liquid that we'll be using every couple of weeks just to try and knock off the nasty mange mite. If you give her a little treat whilst we put this on. Hey? Here. What's she got? Oh, what's she got? That's a good girl. There you go. So, my love, I think let's start that me time right now. And I think because we're going to have to examine the puppies and probably have to do a few mean things to them, it's maybe best that slightly nervous Mum goes and have a little rest.
Yes.
Yeah. Hey?
There you go, Sammy.
Good girl.
Thank you.
Well done. She's off. I've shown a lot of restraint. So, look, hand over the puppy. Come on. Oh, look at you. Mwah. So who's this one?
This one's Bear.
Bear.
Yeah.
It's a good name. He's going to be a big bear, aren't you? Yeah. Now, these guys, a bit young to be vaccinated as yet, but we can microchip them.
Yeah.
So have we got something to entertain his mouth in? Have we got some? Oh, here we go. There we go. Very good.
You ready?
Brave boy.
Oh, well done.
Well done. Good boy, Bear. So let's just make sure he beeps. And he beeps. What a brave boy. Right, so who have we got next?
We've got Prim here.
Me too, Mum. Oh, wow.
Good girl.
She's done. Okay. Good boy. Well done. I can't believe how brave these puppies are being.
Well done.
And then last one. Very brave puppies,
Good
eh?
girl. Yeah.
So that's 5 very healthy puppies, all microchips, and they took that on the chin very nicely, I thought.
They did really well. Yeah.
But I just can't believe the amount of work you have to do looking after the donkeys and a goat, and then you take on dogs as well. But there sort of is a little bit of reward, isn't there?
There is.
And they're its own sort of special way. Isn't it? Yes, yes, yeah. You're a nice puppy.
But now it's time for Scott to say goodbye to owner Jenny and her family.
I think we'd better finish that bit first, yeah?
Eating well?
Very good, very good.
Jumping on a carrot. Well, I'm going to head back to London, ladies. So thanks so much for having me.
You're very welcome.
Yes, thank you for coming. I really appreciate it.
Can I just have one more donkey cuddle before I go? Goodbye. Goodbye. Oh, love it. See you again.
Bye, Scott. Thank you.
Now, Betty, we're waiting for Scott. I don't know whether to look forward to seeing him or to dread it.
In Richmond, Julia is at home with BAFTA, nervously awaiting Scott's arrival. Scott recently removed a cancerous tumour from underneath BAFTA's eye. Today, he's making a home visit to deliver the pathology results.
Hello,
Scott.
Julia. How are you, lovely?
Well, I'm a bit apprehensive,
Are you?
as you can see.
Baffy, you're looking a little bit grumpy. All right, come on. Let's chat things through. So, we knew it was a tumour, okay.
I know.
But the news is good.
Scott! Oh, tell me.
So it's come back as a low-grade mast cell tumour, which means it's highly unlikely to spread.
Oh, wonderful.
Yeah.
Oh, thank God. So I'm not going to lose her.
You're not going to lose her anytime soon.
Thank you so much. I can't tell you how worried I've been.
You're very
welcome. I've been so worried.
I know.
Oh, that's wonderful, Scott.
Well, I think with all of that good news, we need to celebrate with our BAFTA party. Bubbles, baby.
Oh, hooray! Baffy, look, Baffy, you're going to have some of that.
And apparently, quail's eggs.
My God, Baffy, they're your favourite, aren't they?
It's possibly the poshest dog treat I've ever heard of.
I feel really happy and really relieved. And maddening though she can be with her barking and her greed, I don't want to lose her, so I'm very glad I'm not going to. Oh my God.
Oh my goodness.
It popped, didn't it, Baff?
Well, I'm glad I'm better at surgery than I am at opening champagne bottles. Okay, Baffy, let's not forget you. Ready? Nice and gently, please. Oh, yeah.
Another, please. He has saved her life. He shouldn't be called Bet on a Hill. He should be called Bet on a Pedestal, because he's certainly on a pedestal for me.
Well, cheers to BAFTA. Long may she reign.
To Baffy and to Scott, thank you so much for what you've done. Saved my little girl's life. Thank you so much.
Cheers.
Means so much.
Hi. This is Fifi. We're here to see the vet.
Yeah, no problem. Just take a seat over there for me.
In Richmond, Eva, Adam and their son Jakob have brought in their injured spoodle Fifi to see Scott.
Fifi had a little accident and we went to emergency vet yesterday, and it's highly possible that the leg is broken. So we're here to see Scott.
We are really worrying because we can see that it's not right, because she's like crying.
Hello, guys. Your eyes. Oh, dear, Fifi, you're looking very sad today and sporting a very interesting sock, so I think that tells me something. Let's have a chat, shall we, guys? In you come.
We pray that Dr. Scott will put her back on her 4 legs as soon as possible.
Tell me what's happened.
She fallen down the sofa.
She fell off a sofa?
Yes.
Okay.
And this is the temporary bandage, emergency one.
Poor little Fifi. She's such a sad little shadow of her former self. Normally she's the bouncy, happy, white, fluffy dog, like my dog Scully. She looks very sad indeed. Oh, is it very sore? Yeah, she's quite tender. Just me touching that a little bit
Yeah.
is enough for her
No,
to
she
flinch.
didn't want us to touch it at all.
Well, I think probably what's best is if we just do a little conscious x-ray, and from that we can work out exactly what's going on and what we're going to do about it. Sound good, Jakob? Hey? Yeah? Have you fallen off the sofa ever? Let's just check this arm.
Just to be sure.
Yeah, that's good. That one's good. Excellent. So hopefully Fifi's leg will be good too. Yeah? Okay then, Fifi, let's pop you downstairs. Okay, guys, if you grab a seat up front, I'll take an x-ray with your little girl and then we can have a look at the x-ray. Yeah? Okay. All right. Say bye-bye. Bye. See you in a second.
We really worried what Scott will say and what's the condition of the leg as well, and what will happen.
All right, Reagan.
Nurse Reagan will be assisting Scott with the x-ray.
Good girl. Taking Fifi downstairs, it's very easy just to pop her leg under the x-ray machine with me all gowned up in lead.
X-rays.
And we'll see what lies beneath.
Wow.
Oh. Gosh, yikes.
At Scott's St Margaret's practice,
Hi, Beata. How are you?
Fine, thanks.
concerned owner Beata and her pet hedgehog Louisa have arrived for an appointment with vet Tina.
And Tina will be with you in a minute.
Thank you.
Okay.
She has a small bump on her head, and I want it to be checked that there's nothing wrong, just to be on the safe side. I really love her. I can't imagine that there is something wrong with her again.
It's been a tough few months for the little hedgehog.
This is very hard.
She had to undergo major surgery when Scott discovered a huge cancerous lump that had to be removed.
So this is absolutely huge. I mean, for a hedgehog, this would be like having a bowling ball growing in your abdomen. Oof.
Morning, Beata.
Hi, Tina.
How are you?
Hi, I'm fine, thanks.
Come on, bring
Thank you.
little
Really
Drew.
great.
The love Beata has for Luta is comparable to any other relationship any owner has with their dog or cat or parrot. It's just so special, and it's very touching, actually. All right, what's going on with Luta today?
I just want you to please do a checkup because there's a small bump on her head. It's very slowly growing, but I think it just, to be on the safe side, just have a look at it and then try to figure out what is it.
Okay, let's get her out and have a little look. Hello, honey.
Oh,
She says I'm tired. Oh, come on.
Luta.
Come on. Are you going to let go of the blanket, honey? Luta's come in today quite a bit hissy, which I think is more related to the practice and the smell of the practice and a remembering of her previous time here. Maybe bring her out with the towel, and when we put her down, she might let it go.
I don't think. No.
Here we go, honey. Come, we can be best friends again. Beata is concerned about her baby, and we need to put her concerns to rest today. Maybe she did bump her head or something like that?
I don't know.
So what I would like to do is to give her a little bit of gas again like last time so that she can let me sample it, and then I can make a smear and see what's in there and if it's something we have to worry about. Any lump or bump that you find on any animal is a concern. There you go. We need to make sure that it's not something nasty that can spread. So we need to take the relevant steps, and today we'll be sampling it first to see if it does need removal or not. Say bye, Mom.
My love.
Oh, we'll look after her.
I know.
Bye.
Come around here, guys, and take a look at that.
Back at the Richmond Practice, Eva, Adam and their son Jakob are finding out the results of the X-rays on little Fifi's injured leg.
So this is one bone, or there are two bones?
2 bones. The radius and the ulnar are both in the forelimb, in the forearm, and they've both been broken. So it's an extreme fracture for just falling off a couch. But the thing is with these little dogs, they have really brittle bones, and just an unfortunate fall can lead to a fracture like this.
From little jump, she ended up with like proper broken leg, so no one expected this. So will the bandage be okay for it? Will it be enough?
Unfortunately not, no. What you can see there is the muscles have contracted and we've got overlap of the fracture site. So this will heal very badly if it isn't fixed internally. So we're going to have to use a mixture of pins and plates, lots of hardware. It's basically a bit of DIY with a pulse, I'm afraid, for little Fifi, but it does need to be done. Yeah. So your little dog needs surgery. It's no good, is it? Okay, guys, well, I'll take care of your little fluff ball. And you guys head home and we'll see you a little bit later.
Thank you so much.
Thank you very much.
My pleasure. Bye, guys. See ya.
In touch. Thank you.
Bye.
We are really, really worried, and I hope everything goes well. Fingers crossed.
Good girl, we'll fix you up. Here we will. Here we will.
Hi, honey. All right. Here's Luta.
Oh.
Okay, so she's got a little bump on her eye. So
Okay.
we just need to have a check.
At St Margaret's, Nurse Sam is assisting Tina with the procedure on Luta, the African pygmy hedgehog.
Hey, look at you. Hey, you can actually see the bump on her left eye while she's curled up. Bit pink in color. We need to figure out if it's a growth or a cyst, and if it is a growth, how nasty that growth could be.
2 months ago, a malignant tumour was removed from Luta's uterus, and Tina is now concerned the cancer may have spread.
Okay, all right, let's quickly turn her on her back and we can do a quick scan. While we've got her under the general anaesthetic, we're going to quickly do a little ultrasound scan of her abdomen just to check that everything is all right following her previous surgery with us when we removed the tumour from her uterus. So basically I'm looking for big nodules or circles or any large abnormalities. But at the moment, everything looks normal. Okay, let's get her cleaned up. At the moment, it's looking pretty good. I can't see anything abnormal.
Now Tina is going to take a sample from the suspicious lump that's appeared on Luta's head.
We're going to be sticking a needle into the bump to get some material to see if it's infectious, inflammatory, or if it possibly still could be cancer. Here we go. I'm hoping it's not connected at all and it's just a little bump and she's healthy otherwise, but the test will give us the answers. Look, there's fluid coming out of there. Okay, let's make a smear. Okay. I looked at the slides, and the one slide, there wasn't much on there, which was good, but the second slide, unfortunately, did have a group of cells, which I'm not 100% sure what they are, and we're going to send it to the lab for them to evaluate it, to let us know if it's something to worry about. I'm going to pop her in here, in her little safe place.
It will be a tense few days waiting for the pathology results.
She's already hissing at me. Hi, honey.
Luta will stay at the clinic a little longer before she can hopefully go home later today.
Okay. She's quite grumpy. There we go.
How did it happen? It's almost too hard to believe. She fell off a sofa.
What, and snapped both of the bones in her front leg?
Yeah, and she fell onto the floor about a foot, and that's what's happened.
Wow.
Yeah.
In Richmond, Fifi the Spoodle is being prepared for surgery to fix her badly fractured foreleg.
Okay, with that dressing off, you can see just how floppy that leg is.
Makes you wince, doesn't it?
The forelimb of a dog, like the forearm of a person, has got two major bones in it, the radius and the ulna, and both of them help to splint and give stability to that limb. And in this case, we have both of them broken, so it's literally flapping in the breeze. It's horrific. Such a fine-limbed little thing, isn't she? So delicate. So we had to fix you right up.
Assisting Scott with the surgery is his new vet, Phoebe, and nurse Nathan.
Okay, all right, so nice and gentle there. Her bones are really only the size of a chicken leg, so they can very easily break, and as a result, you need to take your time and get the best job possible. Okay, everyone ready? Yeah. Okay, and just be quite gentle just with the fracture. There. Very clean break. There's no fragments, it's just two ends of a bone. Just trying to encourage these two bits to go back together. These bones were overriding, and by overlapping like that, the muscles then contract. What that means for you as a surgeon is you need to stretch those muscles back out to get those two sides of the fracture site opposing again. At the moment, she's got a leg a little bit like the S-bend of a toilet. We need to give it stability. So what I'm doing right now is placing a pin into the cavity of the bone. So we're going to put a pin up and then push it back down into the bone at the bottom, and that will put it in alignment, and then I can go back and put a plate onto the radius. You have to do it very delicately, Phoebe. I'm just going to push against you a little bit, okay? We have to do it very gently because it can easily shatter the whole bone if we're not careful. This is quite a nerve-wracking moment, placing the pin, because clearly Fifi's bones fracture easily, and we're putting quite a decent amount of hardware on the inside of the bone, so we have to be very, very gentle.
Oh, there you are. You're there.
That's perfect, Phoebe. Just like that, all right? Once I'm able to stretch the muscles and get the two ends of the radius in a position, I then place the plate, and that's requiring drilling some holes, little pilot holes, and then screwing some little screws into that bone. I do 2 above and 2 below the fracture site, and that gives really great stability and should mean that Fifi makes a full recovery. There we go. All right. It is now solid. Okay, so let's close up. So can I get some 3O monochrome, please, Nathan? This plate will remain inside Fifi's body for life, attached to that bone, and then the bone will form a callus. It'll start sticking back together to itself, and that will give stability in the long term. Okay. Oh, poor baby. Okay. Good girl. That's it.
Fifi will be kept at the clinic and closely monitored overnight to make sure she's well enough to go home.
Okay. Oh, that's it. Perfect. Just what you need. Oh, sweetheart, you're okay.
At St Margaret's, a concerned Beata has returned to be reunited with her beloved pygmy hedgehog.
Hello. Hi. Hello, ladies.
How
How
are
is
you?
my tiny baby?
My baby's fine. She's in the consulting room. Are you ready to go see her?
Of course.
Vet Tina has taken some samples from a suspicious lump on the little hedgehog's head, and they've been sent away for testing.
I'm holding thumbs that these results come back perfectly normal. I'm not 100% sure, but we will find out, and we will do the best for Luther in the end. So she was a very brave girl today. We managed to get a sample from the mass. I've withdrawn as much fluid as possible, and I made a little slide, and I looked at it on the microscope. One of the slides does have a cluster of cells, but I'm not sure what they are. I'm just going to send it to the lab to see what they think it is, and then we take it from there, whether we need to watch it. We need to see if it's going to fill up with fluid again, and we need to redrain it, or possibly look at removing it. And the lab should give us our results in about a week or so, so I will give you those as soon as they're in.
I don't want to think about the sample. You know, it's always you have to be very positive, and until no, I don't think there is no problem with her. I know.
Bye.
Daisy, you're gonna be all right.
The next day in St Margaret's,
Gonna be all
Royston and Laura have made an emergency appointment for their very sick pug, Daisy.
We noticed her a bit lethargic and she wasn't really herself. She was panting a lot, she started shaking. So it was sort of by early evening, we got more and more nervous because she's just not herself at all. So we need to get it sorted.
Hello there, guys. Hi.
Hi, Doctor.
Hi, Royston. How are you, mate?
Morning.
Hi, gorgeous.
Hello, sweetheart.
Hi, Doctor.
You all right?
Well, not really well. These days, Doctor, not really well.
Hello, Daisy. Looking very sad. Panting a little bit. So you're not comfortable, are you, baby?
No, not at all.
All right, well, we better get you in and have a look at you, hey? All right, come on then, team. In we go. Daisy is a very much loved part of a family of 3 other dogs, and of course, Royston and Laura. They're incredible clients, they're wonderful owners, and they adore their animals. Well, let's have a little examination. I mean, the first thing I could feel is she's just like a hot water bottle, isn't she?
Yeah.
She's so warm.
Yes.
Yeah. And that's why she's panting then, and obviously a bit uncomfortable as well. So, okay, let me just have a feel of your tummy, my love. Stand up. Wow, yeah. So straight away I can feel just how tense her abdomen is. She's really bearing down, like as if she was about to give birth or pass a big poo.
Exactly.
But that's not been happening, has it?
No.
We thought it was a stomach problem in the beginning, like because she couldn't pull, but no.
And let's just have a look at her back end then. So yeah, I can see it's a bit stained back there. And when was it that she last had a season?
She had a season about 6 weeks ago.
Yeah.
So it's just...
And is she drinking more than normal?
Yeah. She's drinking a lot more than normal.
Yeah. Daisy's been brought in with a potentially life-threatening condition that's called pyometra, which is basically an infection within the uterus. Unfortunately, we do need to perform surgery on her and remove this infected uterus.
Well, we have to, it's the only way to get her well. Go ahead, you take the decision, we follow you.
Pyometra can be life-threatening. It can make dogs really unwell, and sometimes they don't survive the anaesthetic or the surgery or even get to the vet practice. Now, I have complained and begged them to neuter their dogs sooner. They know that. It's something they're very concerned about because Laura in the past, being from Colombia, had some bad experiences with vets found it hard to trust them, and Royston as well, incredibly nervous about the dogs that he loves so much, worried about the anaesthetic and will they wake up from it. So they have held off from doing a spay, but unfortunately that has turned around to bite them, because if an animal's spayed, they don't have a uterus, hence they can't have pyometra. There's been anaesthetic issues in the past, there's been concerns regarding how your dogs have been treated in the past, that you've been so frightened of doing it.
Yeah.
But unfortunately, because of that fear, we're here right now, which is a real shame.
Yeah.
Yes. I've cancelled maybe 2 or 3 times the day before when she has to go for the operation to be spayed, just through nerves. I get nervous like weeks ahead of the time.
I know that you guys are super worried. I know that's the reason why we've been unable to get you in the building to do it, but it is something we desperately need to do, and now she actually feels unwell.
Yes, definitely.
Come on then, I know you love them very much. I just need to remove that excess baggage is what I need to do. Yes. Say bye, Mummy.
Bye, Michael. We'll see you later on.
See you later.
Bye. We are worried, but we, in the same way, we think it's
It makes
fine.
me slightly less worried.
Yes, yes,
in
yes.
Scott's hands.
Yes.
But still very worried.
Yeah.
Very worried.
Sort you out, don't we, eh?
Sweet. Sweet.
Hey? Yes. Hey?
Scott's new vet Phoebe's next patients aren't at any of the clinics. They're out on the streets of London.
Today I'm off to the Strand in central London to help out with a charity called Dogs on the Street, run by a lovely lady called Michelle.
Stands out.
Really looking forward to it.
Oh, was that a visitor?
Hi!
Hey, how are you?
I'm good, how are you?
Yeah, fine, nice to meet you. Thanks so much for coming along today.
No problem.
This is where you're going to be today, okay?
Can't wait to get started.
All right, let's get the tables out.
Yes.
Let's go.
Let's go.
Dogs on the Street is a not-for-profit, voluntary-run service providing free vet care, training, grooming, all the essentials for the homeless community with their dogs that live out on the streets in central London. We're here with a team of vets, vet nurses, a trainer, grooming van, and also volunteers, so that when they come along, everything's there for them to access.
Hiya!
How are you?
You're right.
I've come to see you for Fizz.
Hello, Fizz.
Phoebe's first client is Michael, with 15-year-old Fizz.
I'm not really sure what to expect. I've never done anything like this before, and it's really different to private practice. You were here a couple of weeks ago, is that right?
Yes.
These are very vulnerable people that have absolutely nothing, and maybe it will be hard to see them not maybe able to care for their dogs in the way that they would like. I'm hoping that we'll be able to give them the best possible care today. Right, should we get her on the scales then? On you get, Fizz.
Come on then.
About 24.5. So she's put on about 200 grams in a week.
In a week?
Oh.
Their diet is so inconsistent. It's just basically what they're in, they can actually get their hands on to feed. And again, the homeless people go without. They provide their dog more than they do themselves.
That's all I'm giving her on the dog chews.
Is that every day?
Yeah.
Okay.
Yeah.
So those have a lot of fat.
Yeah.
So if you were giving her that, then you need to give her less of her normal food. And I would say no human food if you can.
The dogs are their life, the dogs are their children, their family. They are the most loyal fur baby, as we call them, that they have. And, the love goes so deep, it's so hard to describe. But, yeah, they just mean the world.
Hi, Gary, I'm Phoebe.
Next up
nice to meet
is
you.
Gary, with his
is
best
Lola.
friend Lola.
Yeah.
And how long have you had her?
5 years now.
Wow.
Best 5 years of my life.
Oh.
Lola is my Staffordshire Bull Terrier. She was 1 year old. She was found abandoned in a flat. And I just moved into premises from the streets. I wanted a dog because the resettlement team thought it'd help me settle. And they went to Battersea with me and we chose Lola. And I've had her ever since. Yeah, I just love her.
In you come, Poppet.
Come on, Lolly. Good girl.
I haven't seen Lola before, so can you tell me a bit about her?
She had the elbow dysplasia.
Elbow dysplasia?
That's what they said, yeah.
Oh, okay.
Yeah, at the Blue Cross. And
so that's why Dogs on the Street have been giving her hydrotherapy sessions?
yeah, she's been having hydrotherapy. She's got 3 more left.
How many has she had already?
7.
She's had 7?
Yeah.
And how has she been doing?
She likes it, but she'll only do it if she's got a tennis ball in her mouth.
Elbow dysplasia is basically an abnormality of the cartilage in the elbow joint, which means that it doesn't develop properly. Should we just see how she walks then? And then you can get fragments of bone falling off and secondary arthritic changes. So it's quite nasty and it's quite painful for the dogs. Can you just walk her just to the end and back a few times?
Yeah. Okay.
So to examine Lola, I trotted her up and down to see if I could see any lameness in those front legs, but she was walking really well. She's not limping at all, is she?
No.
Right then, Puppet. We'll have a little feel of those elbows as well.
Yeah. It's all right, Lol.
Look at that.
Yeah, she'd have cried if you'd done that a couple of months ago, yeah.
Yeah, she's got a really good range of motion on that elbow joint.
Yeah,
and
she
she's
never
not
used
painful
to.
at all.
No, good girl.
Seeing cases like Lola and Gary is what's so inspiring. He's helping her with her elbow dysplasia. She was the one who inspired him to get off the street in the first place because he wanted to do it for her.
Oh, you want to see more? The scales weren't lying, Lola. They weren't.
It's just another example of such a loving bond between an animal and their owner. And it's what inspires me as well to go into work every day because you just want to strengthen that bond and keep it alive for as long as possible.
Good girl. No, it's not more treats. She's through, man.
Bye.
Bye. Lolly, come on. Good girl.
Hey, Sam. You all right?
Hello, how are you?
Good. Daisy's not so great, though. Poor little thing. She's got pyometra.
Oh,
Having your baby.
that's not nice.
So she feels like a little pug-shaped hot water bottle at the moment. So she's just not well, are you, baby?
At the St Margaret's practice, Scott and Nurse Sam are about to start surgery on sick pug Daisy.
Mummy, you're a much more bouncy little girl, aren't you?
The little dog has an infected uterus, and it's making her extremely unwell.
I feel for Royston and Laura because they feel very, very guilty that they didn't heed my advice about neutering.
Obviously, there's risks, but...
Yeah, and also being a pug, as you know, there's risks on top of that, and then she's a sick pug, which is even worse. Daisy is not in the best place for surgery. She's panting, she has a fever, and also she's a pug, so she's not built for breathing very well. She's got a tiny little flat nose and a flat face. So all the issues associated with breathing in that breed, compounded by illness, means that this will be a risky anaesthetic. Okay, sweetheart, we'll see you on the other side, yeah? Good girl. We very carefully and gently move forward, giving her the minimal amount of anaesthetic needed in order to knock her out. Spin around. There we go, sweetheart. Good.
But seconds later,
oh my God,
Daisy's in trouble.
Even despite our best efforts, she stops breathing. Can you grab that drip bag and just bring it through?
Vet nurse Lily has been called in as an extra pair of hands.
Can I just put this under a towel?
Yeah. Despite all my tricks of the trade and then even some drugs, she still continues to not breathe. Or what's then worse, her heart starts to slow down. Can you grab that drip bag and just bring it through?
Should we get the monitor?
Yeah, and the monitor as well.
At St Margaret's, 5-year-old pug Daisy has crashed under anaesthetic.
Daisy was in trouble. She'd stopped breathing, and with her heart slowing, we needed to make some very smart decisions very quickly. Just get some adrenaline at the ready, quick as you can, Sam. I asked for some adrenaline to get her heart beating stronger, and we give it to Daisy.
Do you want to give us some IV?
Yep.
SpO2 81, going upwards.
Okay, heart rate's much stronger now.
Daisy's heart rate is responding well to the adrenaline.
So about 1 in 5.
But she's still not breathing.
We're in a good position. Come on. There we go. That was her.
That was her. That's her again.
Yep. Okay, that's good. Okay, so just put her up to 2. This is why anaesthetics are risky. This is why we want to do spays on healthy dogs, not sick ones. There we go. Her heart rate's nice and consistent now, so she just needs to breathe in that gas and then we should be in a good position. Well done, everyone. She's back now. Gosh, she took her sweet time, didn't she?
Mm-hmm.
My heart was in my gut because it is like doing a procedure on someone's child. Little Daisy here, and we nearly lost her. Yeah. It's almost where their concerns are realised, you know.
Yeah.
They were worried about an anaesthetic. Well, for the last 5 minutes, so we. So,
If I breathed in that time.
no. My heart was down here. Although thankfully Mum was beating at times, Shez was trying not to. That's too much. Too close. Too close. And for people that, you know, talked about how much they trust you and how much faith they have in you, and then that happens, it's even worse.
Daisy's breathing is now stabilised, and Scott can begin removing the infected uterus that's making her so sick.
Okay, the size of it. So that's her left horn is just engorged with pus. Normally, a uterus of this size would probably be about a little finger, and that is much bigger than my little finger. It's massive. And the sooner it's out, the better for this dog. She'll feel much better, and so will I. Okay, I'm just going to snap the ovarian ligament now. Okay, done. Sam, how's the dog doing?
She's, her heart's going well. That's what we like, isn't it, Daisy?
I'm doing mega speedy surgery because none of us want to be here any longer than we have to be. And we both want to get her woken up as soon as possible. So there's a nasty uterus. Yep, sorry.
That's okay.
As soon as the uterus full of pus is removed, that's a massive relief on Daisy's system. She's no longer absorbing all the toxins that pus is giving off. Here she comes. There we go. Now she breathes. Back to those huggy, abnormal breathing ways. To see this pug make those lovely puggy noises on recovery was music to my ears. Come on then, Trouble. Let's get you all snuggly. Hey.
Daisy will sleep off the anaesthetic and will hopefully be able to go home with owners Royston and Laura later today.
2 rules: heart keeps beating and lungs keep breathing. Yeah, deal?
Do you think she would take a little treat?
Oh, yeah.
What's that?
Here you go.
Oh,
yes.
Back in the centre of town, Phoebe is helping the Dogs on the Street charity give free vet checks to the homeless.
So you do notes on all your patients?
Yes. Yeah, everyone has one of these. They have all the notes written on it.
Let's go and get Gizmo then.
Okay.
Goodbye. Hi.
Hiya.
Gizmo's come for his check-up for his stitches.
His stitches. So he was castrated then?
Yes, he was,
A couple of weeks ago now, was it? Oh, he's really friendly.
Phoebe's last client of the day is Francesca, with her 1.5-year-old staffy, Gizmo.
Where did you get him from?
He was rescued because he was badly ill-treated.
Oh, poor thing.
He was quite young when I got him, but he was very badly abused. He was very thin, very badly ill-treated. And I went in and took him, and that was it. I love him to bits. Yeah, he's my little baby. He's the only man in my life. My little dog.
You can see his little wound there. It's looking really good.
I'd had him done because he is quite boisterous and hyperactive, so he's come to have his stitches checked just to make sure that they're dissolving and that properly.
That's healing really nicely.
Oh, good.
Yeah, really happy with that.
Yeah.
It's holding closed.
Yeah.
It's not painful. It's not inflamed. And hopefully his hormones should settle down a bit now that he's been castrated. You'd never have guessed by the way that Gizmo bounced around the tent that he'd had an operation 2 weeks previously. I think Francesca probably has a hard job keeping him still at times. You've got a lovely little dog here. I've fallen in love with him. He's stolen my heart.
Everybody loves him when he comes here.
You can tell just by talking to the owners for a couple of minutes how much their animals mean to them. They're everything to each other. Some of these people could maybe go into accommodation, but they'd rather be on the street than give up their dogs.
Right, thank you for your help.
It was lovely to meet you both.
Say bye-bye, Gizmo.
Bye.
Say bye-bye.
Bye. I've had such a good day helping out with dogs on the street. It was definitely more than a vet clinic, it was definitely a community. And you could tell that just by the fact that clients will come back week on week, even if their dogs aren't feeling unwell. Everyone has a bit of a chat. Yeah, it was really nice to see.
Oh, that's great.
I'll come back soon.
Oh, that'd be lovely. We'd have you back anytime.
Yeah.
Anytime. Phoebe was amazing, you know, being it's her first time out here, sort of engaging with the homeless community as well. I think she's done great.
Bye.
At the St Margaret's Clinic.
She's showing off her breathing now.
Yeah, back to hug breathing yet again. Some sort of broken vacuum cleaner.
Daisy has fully recovered from the surgery to remove her infected uterus.
You don't even know, do you? What you put us through, all that stress.
Unaware of the drama during surgery, Royston and Laura have arrived to pick up their little girl.
Since we left, I've been a bag of nerves, just waiting for the phone call. As far as I know, everything went well. I guess we'll find out when we speak to Scott.
Hello.
Hi.
Princess.
The main cause for her illness, which is that uterus full of pus, is now gone. But I'm very glad to have passed her back to you because she wasn't breathing initially when we gave her the anaesthetic. So the concerns you had regarding the anaesthetic were valid. But then her heart started to slow down a little bit, got a little bit fluttery and hard to hear. So we had to treat her with emergency medication. But thankfully, very quickly she came back round and she's here to send home with you now.
My heart just stops to think that it could have gone the other way, basically. It's a terrible thought.
Yeah.
But luckily, she came through and we got our baby back, basically.
Yes. Oh my
So
gosh,
it's a relief, a good, big relief.
Yes.
Yes.
Daisy will be kept on a course of antibiotics to make sure all infection is completely gone from her body, and then she should make a full recovery.
Oh, bye, baby. All right. See you later, guys.
Thank you so much, Doctor. Thank
All
you.
right. Sleep well.
You too. Thank
All
you.
right.
Bye-bye.
Bye. See ya. Bye.
Hello, sweetheart. How are you? Don't you look better?
A day after surgery to fix Fifi's broken leg, the one-year-old Spoodle is ready to go home.
That's a good girl. Look at that waggy tail. Hey? Here we go. Oh, great girl.
Upstairs, Adam and his son Jakob are anxious to see their little girl.
I think everything went well, so let's see how she's feeling.
Hello. Wow. Here's your little puppy.
Oh, Fifi.
The surgery went well, and so that's given the whole leg lovely stability. It will be quite a long road, however. She's going to have 6 weeks of incarceration, so she'll be quite bored. I think it's best that she's in a crate or a cage for that period of time. And of course, no more couches. So we need to try and convince her not to get on couches anymore because we don't know what might happen. Hey, you looking forward to taking her home? Yeah. Yeah, did you miss her while she was away? Yeah. Although going home with Adam and Jakob, Fifi is definitely going to be catching up on all those cuddles she's missed. She has to do a lot of healing, a lot of very controlled rest before we re-X-ray. But hopefully at that point, I can go back and see her running around the hills of Richmond, and hopefully she'll be A-okay. Bye.
Bye.
You do not like it here. And I hope that your bump is okay, baby. Everything will be fine.
And a week later, Hedgehog Luta's pathology results are back, and Beata and her daughter have come to hear the findings.
2 minutes and then everything will be fine, we know.
Yes.
They're hoping a sample taken from a lump on Luta's face isn't cancerous.
Hi. How are you?
Yeah.
Oh, hello, miss. Come, let's go through.
Okay. Come on.
They've had to be very strong this last year. They've gone through a lot with Luta. She's come through a tumour being removed from her uterus and now a scary little bump that we were all worried about. All right, guys, we got some results back, and that little bump that we drained has come back benign, which is good news, okay? It's not cancerous.
Cool.
Okay. So it's basically, they've classified it as a cyst. So it's a structure that forms a little bit of fluid that builds up, and we just need to keep an eye on it, and we need to drain it if needs be. And if it does become a problem, then we can possibly discuss surgery. But if it's not bugging her at all, I see no reason to remove it, okay?
She's just amazing.
We really love her. I think we are lucky that we have her, whatever happened, that we are lucky that she's still there and she's happy and healthy.
She's going to sleep. Yeah. Good night, Luta. She's really gone to sleep.
In Isleworth, Scott is making a very special house call.
Well, hello, sir. How are you? Yeah, good. Hello, Daisy.
Hey, doctor!
It's 6 weeks since Daisy was rushed into the clinic with a life-threatening condition.
Oh, thank you. I know, to see the girl.
Scott removed the little pug's infected uterus after a challenging anaesthetic.
Thank you. So, she put us all through the ringer. How's she been since the surgery?
Much better.
Say hello to the doctor.
Oh.
Daisy, oh, come on, don't be rude. Don't do that. You're supposed to say thank you for saving my life. She's run around more than before, so it's
She's
fantastic.
got a new lease on life by the sounds of it.
Yes.
Very good. Can I just have a little look at my handiwork there and just see how things are looking? Can I have a look at your tummy? Hey? Well, that's healed really nicely, hasn't it? Beautiful.
I just want to say thank you from the bottom of my heart. Doctor, thank you so much. Thank you
So
for
welcome.
everything.
I know how much you guys love your dogs, and obviously this was one of those instances where you've put off a decision to spay her because you were worried, and it actually made things a hell of a lot worse.
Yeah.
And now, the other two dogs, are we planning on
Yes.
booking them in?
Yes,
They will.
definitely.
100%. They're both going to get done.
Thank you. I think for your sanity and for mine, let's just get it done.
Yeah,
Yes.
for sure.
Yes.
100%.
They have to be done.
Sound good?
Oh, Daisy. Big cooker. Big
It's a
cooker.
very clear no. No more surgery. Go away.
Yes.
Oh my God, you are a grumpy bugger.
And 2.5 months after emergency surgery to repair Fifi's broken leg, Scott wants to see how the little spoodle has recovered.
Good evening. Hi, how are you? Thank you very much. Hello, Fifi. Hello, gorgeous. How are you? Hey?
Doing really well.
Oh, good. And not minding the vet coming to visit at home?
No,
Hey?
she's so happy.
Very friendly girl. All right, well, let's go in and chat, shall we?
No worries.
Cheers.
Please come in.
So, it's an extreme fracture for just falling off a couch.
Scott had to insert a pin and a metal plate to fix the nasty break, and prescribed plenty of rest to give the fracture time to heal.
And so, how's the 10 weeks gone for you?
It's been hard, I'm sure, for Fifi. The beginning part was probably, the hardest because she had the plaster on, so it was difficult for her to even lie down. When we took the plaster off, after 2 weeks, she started putting pressure on her leg, and then she was even happy to run.
Wow.
So she's been really strong and really good.
Well, first thing I noticed when I walked in the doors, you can really not tell which leg it is, which is incredible, isn't it?
Yeah.
With her now fully recovered, is she back to sort of her usual jumpy, happy, bouncy self, playing with the kids?
When we go for walks, when she comes back, she comes and jump on the sofa and just sleep.
Oh dear, you've put Mummy in it there. Jumping on the sofa? No, you can't be doing that. In fact, I've got something to try and stop that from happening.
Aye, aye, aye.
Do not cross, Fifi.
You like it?
Do not cross.
She loves it.
Yes. Yeah, I haven't got authority, have I really?
Not anymore. I'm sorry, I can't stop it.
No. She's just saying thank you for the operation.
Very enthusiastic, thank you. Oh. Luckily, I'm better at fixing legs than I am at dog training, hey? Yeah. No. Yes. I'm
Thank
glad
you
that
so much.
She can use her foot to sort of hook onto me while she's licking me to death. Hey. Yes. Yes. You're a very good girl. Your leg's fixed and your tongue was never broken, was it? Hey?